Welcome to the Deschutes County Board of Commissioners meeting for 9 a.m. Wednesday, April 14th, 2021. At this time, please join me in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time is citizen input. Is there anybody that happens to be in Zoom with a hand raised function for testimony for an item not on the agenda? Okay, seeing none, are there any phone calls possibly? Okay, so we do have 3 items here this morning. These are emails sent to commissioners directly, or citizen input at Deschutes.org is also an email address. There's a request to urge Deschutes County to become a sanctuary county for gun ownership. Without this protection, it's a discussion of an item that is in the state legislature. It has passed one of the houses. So we want to thank you for that input on this topic. And we did discuss this on Friday, so there's a bill, and the position of the county is in opposition, and it was a lively discussion. So, any other thoughts? We also have a mother explaining the impacts of COVID-19 on the kids in the family and what's been going on. So this is acknowledging that, these are some hard times for some people. It's very dynamic. So this is input about COVID-19. And then also a request came in to please stop free testing sites. And then the goal is mentioned is to get back to business and get past COVID. But I think, as I say, this is a request to stop the testing sites, but we have seen in testing sites are important for understanding community spread and the prevalence of COVID in our community. So I want to thank for those 3 input items. Anything else?
Yes, I do want to recognize that it's Hudson's birthday today. Samantha, I believe, is home with her son, but he is 1-year-old today. So I did want to say happy birthday, Hudson, and she may bring him by the office today. So very special day for that little boy.
Okay. And with that, moving to the consent agenda. There's 2 items.
So moved. We'll do those 3 other items at a later point in time, right? They're allocated, the 60,000. Yes. Okay. So moved.
So you're referring to video lottery fund allocation discussions?
Yes.
Yep.
Second.
Okay. Any other discussion? Seeing none, Commissioner Dare?
Yes.
Commissioner Chang?
Yes.
And Chair votes yes. At this time, action items number 3. Item number 3, consideration of approval applied to Central Oregon Behavioral Health Investment Grant. Janice Garceau, Behavioral Health.
Good morning, Commissioners. I believe my colleague, Kara Cronin, will be joining me as well, but for the record, I'm Janice Garceau. I am Director of Behavioral Health for Deschutes County, and I'm joined by Kara Cronin, who is the manager of the Intensive Adult Services Program. So she has followed Molly Wells-Darling into that vacancy, and it is official. So you are meeting her in her official capacity for the first time today. So we are here this morning to request permission to apply for a Central Oregon Health Council non-competitive grant in the amount of $833,589 for the express purpose of addressing the needs of older adults with severe mental health conditions for a 3-year period. The grant will fund proposed FTE and help cover the cost of some psychiatry and supervisory responsibilities, as well as 1 vehicle, since these clinicians will be mostly in the community providing services. Kara Cronin can provide a little bit more detail about the intended purpose of the grant if you would like to hear a bit more detail.
Yeah.
Sure, just a little bit about the vision of what might be done with these dollars.
Kara.
Thanks. Yeah, we're really excited about this possibility. We have a lot of need in Deschutes County for our older adult, severely mentally ill, complex clients. We have not been able to reach some of our more rural areas of the community. So we're really hoping to expand these services to Lapine, Sisters, Northern Deschutes County, as they've been underserved. So these are positions that are going to be out in the community bringing behavioral health care and supports to people in their homes, in the community, and in facilities, which as COVID-19 has highlighted, there's some real disparities in how older adults are able to access healthcare. And the other part of this is to provide some more community education to our area facilities serving older adults and primary care clinics serving older adults to provide some education on behavioral health care specialties.
Great, thank you. Any thoughts?
I was just curious, Janice, when you were introducing this item, you said that this was a non-competitive grant.
Correct.
So you still need to submit a proposal, but if you submit a proposal, you're guaranteed the funds?
Yes, sir. We are guaranteed the funds if we submit a proposal.
Okay.
We actually, this was part of a presentation for the Central Oregon Health Council. I believe I mentioned it maybe a month and a half ago or something, 2 months ago. And it's a wonderful opportunity to do something with some continuity, a couple years, and I'm really glad, Janice, that you were able to come up with the program, and we'll actually see what kind of an impact. A couple years could make a serious big dent on our mental health in the community.
Well, and I appreciate the fact that we're putting a plan together. So if this is a 3-year grant amount and this amount, how to get the FTE hired, but the overhead and support for that position. I'm just seeing the licensing, training, transportation, office supplies, being able to really be business-like and how this might flow in the next few years also.
Yes, sir. We try to cover all costs allowed when we're applying for these types of grants. And just, in a call out to our coordinated care organization, Pacific Source, these dollars are available because our CCO, unlike many others, does make a commitment to share profits back with the community through these kinds of efforts. So I think we're fortunate to have our partnership with them and work with the CCO that does say we're not just here to make profit, we're also here to share some of those profits back with the community for needed services that can't be covered otherwise. So we're very grateful for that.
Great.
I think it's very exciting that we are bringing services to people where they are in their homes and in their more outlying communities in Deschutes County.
Thank you.
Is there a motion?
I move to approve the application for a 2021 Central Oregon Behavioral Health Investment Grant to the Central Oregon Health Council.
I'll second it.
Okay, it's been moved and seconded. Any other discussion? Seeing none, Commissioner Chang,
Yes.
Commissioner Dare,
Yes.
and Chair votes yes. Thank you so much.
Thank you, commissioners. Have a good day.
Thank you. Congratulations, Kara.
Thank you.
Item number 4, consideration for request to accept grant funds from Food and Drug Administration. Eric Monet at Environmental Health.
Oh my gosh, whose dog is that?
That was
Sharon's
Kara's.
dog? Oh, is that a corgi, Sharon?
Good morning, yes.
Good morning, Commissioners. I had a little gap getting connected.
I just introduced the item and you're on. Yes, welcome.
Right. Eric Money, Environmental Health Supervisor. Thank you for the time. Last fall, we applied for 2 FDA grants. And then earlier this year, FDA awarded us those grants. So just coming to you to see if we can receive those. The 9 FDA food program standards really define what constitutes a highly effective food inspection and a responsive food inspection program. So we're just looking forward to getting to work on evaluating where our needs are, where our gaps are, how can we improve. If an inspector says, I'm inspecting a lot of restaurants, I must be doing a great job. My first question is, how effective were you at making that place a safer place to eat? Not how many inspections did you do? And so this grant will provide for an assessment of if we're meeting those standards that have been set forth, and then provide, the second grant is a $3,000 grant to provide training to make us more effective in achieving those standards and meeting those. So any questions about that?
I'd say it's pretty exciting being able to take a step back for the self-assessment. It's nice to have a little bit of funds to be able to do that, justify it, somebody's time to be able to really focus on the big picture. And then following on for some training, whatever the focus areas might be, what kind of information is the newest out there that we could share among the team. So it's really wonderful to be able to just take, it's $5,500 total, but it could be very impactful for the restaurants and the people that eat out.
I'm really excited that this presents an opportunity to invest in our people. And I was actually curious, Eric, how often environmental health staff have the opportunity to do trainings like this or kind of do professional development?
Well, we are required as environmental health specialists to get at least 10 hours of training per year to maintain our certification, and that can be in any number of realms of environmental health. This one is very, the $3,000 grant pays for specifically food safety training, and so it just helps out a little bit with paying for that, which has become less expensive to go to conferences when they're only Zoom and you don't have to travel there.
Yeah.
So we're going to be able to send, because of an unintended consequence of COVID, I believe, is we're going to be able to actually get more people trained via Zoom meetings than sending them to a 3-day conference in Spokane.
Sure, there'd be a lot of benefits to going and meeting colleagues, networking with people who are doing the same work that they are from across the region. But that is, we'll take the benefits of COVID when they come.
Exactly.
Okay, is there a motion?
Yes, I move consideration of the request to accept the grant funds from the Food and Drug Administration of $5,500.
I second.
Okay, any other discussion? Seeing none, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And chair votes yes. Congratulations.
Thank you, Eric.
Thank you very much.
For that.
Appreciate it.
Thanks, Eric.
Thank you.
We're working right through our agenda here today. So item number 5, County Administrator Recruitment and Hiring Procedures Review and Public Comment Opportunity. So a bit of clarity. So public comment opportunity, is that like opening and closing a public hearing on the subject, or what?
Not technically a public hearing, but it would be an opportunity that anybody that is either here or on Zoom that wants to weigh in have an opportunity to voice whatever it is they want to voice. It's a requirement in order to subsequently be able to discuss the new county administrator hiring that person in executive session.
Okay. So, and this is published on a public agenda, so people that are following, media, whoever, it's an opportunity to understand we are in the middle of a process of recruitment. We want to thank anybody that's following this, and please become informed. So Kathleen, thank you for joining us.
Thank you, Commissioners. Kathleen Hinman, HR Director. We're just, as you kind of heard from Dave Doyle there, that this is a little bit of housekeeping to make sure that we will be fully complying with ORS 192.660. In front of you, we have the County Administrator job description, the County Code chapter, which there were no changes to, the executive search flyer, our County Administrator recruitment planning, as well as the selection process timeline that through a series of separate meetings and one-on-ones, we've kind of come forward with this as our plan for recruitment. So with these materials, I think that, as David Doyle mentioned, just offering the opportunity for public comment on these will allow us to then move forward with Monday's executive session to evaluate the candidates.
Great. So I guess for clarity, so Tom Anderson is currently our Chief Executive Officer, County Administrator. The county code is defined here, Chapter 205, talking about the authority of that position. And Tom, you announced a retirement in the future. Is that how this all got kicked off? And what's the date on that? I guess I don't have that off my hand. And,
Yes, Commissioner, I let you know a couple months ago that
Yep.
I intend to retire at the end of September.
end of September, okay. I would forget if it was August or September. So end of September is kind of the time frame for us here. So there's only two direct employees of the Board of Commissioners, County Administrator and County Council. So that's acknowledging to the world that, I mean, that is how it works. When we do, as a board, do employee review, it's really only for those two employees, and then the organization flows it down from there. So the packet's pretty thorough about the process we're involved in at this time. Any other thoughts or comments?
I heard I needed to get a great big huge giant bowl of popcorn because
Yeah.
reviewing things, yes, and I go, oh my gosh, that's not on my food list at the moment. But it sounded like a good idea.
Would it be helpful for Kathleen to kind of just give a little bit of a snapshot for anyone who's watching, kind of where what has already occurred and what the next steps are in the process?
I can do that for sure.
Yep.
Yeah. So, the initial step is to evaluate how we're going to move forward, right? So is the current process in terms of county administrator, that structure even, the way we want to move forward, evaluate if we're going to make any changes to the code or job description. It was determined that we were going to move forward with the same structure that we have been. So no changes to code or really the county administrator job description. So we moved forward with posting that announcement and hiring process. We also created an invitation to apply. And so that was through a lot of input in terms of providing details to the public just on, what this position is going to do, the kind of the big items that are really coming forward in terms of what this position will need to be working on, what is the sort of short-term and long-term projects, considerations for Deschutes County, and then Deschutes County Commissioners and how to support commissioners. So that was created and published. And actually, we got a lot of really great feedback on that flyer. And so that's out there. And then the next piece was really that we determined how we're going to move forward with the search process and a timeline of the recruitment itself. We ended up going with kind of a standard recruitment model where we have, we completed the profile development. We posted and advertised. We did a pretty broad advertisement plan in terms of diverse sort of pools, right? So we have a diversityjobs.com, which goes over all sorts of different areas, women in government, minorities in government. And so we really focused on that, as well as our more traditional avenues, which are like the AOC or the ICMA websites, so our more traditional government websites. And so we went through that. And then we received, actually, I would say, a pretty decent amount of candidates. We ended up with about just under 60 candidates, reviewed that, narrowed it. And so we're in the candidate screening and selection process. And we just completed first round interviews, which is exactly where you'll need that bowl of popcorn if you're on that selection committee, because we did them virtually and they're pre-recorded. So the selection panel is reviewing those and scoring those. Next steps would be for the feedback from those selection panelists to come to the board. Essentially, HR will be collecting all of that information and summarizing it for the board's review so that we can determine what the top candidates, likely 5, will be in order to move forward. We'll then conduct the final interviews, and current plan is to go in person with those. I will say it's kind of a day by day in terms of how that looks, but that's the plan right now, is to continue with the expectation of in person. We haven't heard any real big pushback from any of the candidates yet on that. And then that will be a multi-day process, let's see, scheduled currently for about May 13th and 14th. And after that, we'll ideally have one finalist and we'll conduct referencing, offer extended, anticipating a smooth transition. And then Tom can, meet that date that he's already announced and head off into his next big adventure.
So yeah, this is the agenda item for that opportunity for the community to hear the process and the current status. At this time, I'd like to acknowledge this is an opportunity for public comment. So we do not have anybody in the room on this topic today, but would there happen to be anybody in the Zoom meeting with a hand raise function? And are there any phone calls, any phone numbers that are there? Okay, so we have at this time no public comment on the topic. But as I say, I do advocate for the community to understand this is the chief executive officer of the county. Department heads work for this position. Other elected officials in partnership work on the organization chart of Deschutes County, and we've got a great culture of service for the community and people in the area. Any other thoughts?
Well, I did hear that Tom could apply for the president of Oregon State. They're going to be searching for a new president. So Tom, if you get bored of being retired for a couple months, that could be out there.
What an opportunity.
Yes. Yes, go Beavers, right?
Well, it was mentioned a year. So on the radio this morning, they mentioned that sounds like Dr. Becky Johnson may be appointed to that position for a whole year, too. So not.
Yes, congratulations
Yeah.
to Dr. Johnson.
I think that's not quite official yet, but the word is out.
No, it was on the radio. It was on.
Well, yeah, but I think there's a.
They're deliberating this
Yeah,
afternoon,
yeah.
right?
Well,
We assume it's a done deal.
public information was
Yep,
delivered
good.
early.
Okay, well, so as I say, there's opportunities if community members want to contact the Board of Commissioners, any person directly, and have a discussion or advocate or just let us know thoughts. So it's good to have the community understand we're in the middle of this process. Doesn't happen too many times. There's been, 3 administrators in the last 30-something years.
Just about, well, there's only been 3, actually. Before then, the job was different.
Oh, okay, yeah, so there you go, even more specific, yeah. So it was adapted from a judge at that time. I guess I don't know this specifically, but I'm assuming it was a judge and 2 commissioners like Crook County set up, so that was the first administrator, about 1978. So then this is this will be the 4th administrator.
And this is just such an incredibly important position for the operation and direction of our county. And it's great that we're providing public information about it, and I hope that people are tracking.
Yeah.
And Kathleen, the fact that we received almost 60 applicants, amazing cross-section of people. I mean, there was East Coast people, there were people from everywhere, so, and wide range of, collegiate experience, job experience. It was great reading the binder with all those applicants in it. It's amazing. We weren't sure if we were going to get enough, and I definitely think we did get a great group of candidates. So thank you, everyone who applied.
Okay, so that was our discussion currently and recruitment and hiring procedure for county administrator. Anything else, Kathleen?
That's it for me. Thank you, commissioners.
Thank you. So we do have a time certain item number 6, COVID update, and it is 9:25. So at this time, we could share other items, and this is the way our meetings have gone specifically, recently. I'm just trying to think, did I bring in, go ahead.
You have that letter from COIC that was supposed to be discussed at our meeting today.
Okay, yep, so, and I think that one is just an email for me, but I did see that come through.
And then,
Another letter for Sisters Roundabout.
did Eric have an item for us today? Or is that-
So as I say, this is other items in a time on our agenda between our current agenda item and an item number 6, 10 a.m. time certain COVID-19 update.
I think Sharon made a comment about the COIC letter, that it would really be better, looking at the format of the letter, to move the date up to the very top so that it all could go on one page. She just felt like that was safer with our signatures on that letter.
So Housing for All, COIC's request. And I think, is it Meyer Memorial Trust application?
Commissioners, Eric Kropp is on. He's the coordinating the letter, if you have any questions for him.
So do we have a proposed letter? As I say, I do have the email. I didn't print
Right,
out.
for the- Just that it needs to go on one page.
Okay.
We're going to put our signatures on it. It's just safer that way.
So the first action item is to get it to one page, we just discussed.
Yes, we'd be happy to
Yep.
make those changes to get
Or,
it to one
I mean,
page.
Alternatively, if the language is just right, maybe we could put some kind of heading or something on the second page with the, if the
Yeah,
only
the
other
other
thing-
option is the last paragraph, we can space down so that it goes on to page 2.
There you go. I thought the language was fine, and would support signing on to the letter.
And I'm supportive also. I mean, this is a great effort. Let's figure out what, what other on-ramps to housing are out there. It's kind of the big picture. So you're saying not to worry about consolidating it into one page?
I mean,
If you look at the letter, though, where it says draft, it can definitely go up. And I would think, it should be able to fit.
I believe we can get it to one page. Yeah, we'll pull off the draft, we'll space it up.
I mean, someone's more likely to read the letter if it is on one page. I get some letters that are like 3 pages, and I'm like, it just flows better.
So Central Oregon Intergovernmental Council is our shared intergovernmental council of cities and counties in the Central Oregon area, tri-counties plus all the cities. This would be an effort by their staff to really work across, kind of anybody's needs to look for housing opportunities. There could be some good things that come out of this. And it's a request to the Meyer Memorial Trust for funding.
and the Housing for All Coalition work group they've been at it for quite a while. And there's some good ideas and some good questions and kind of needs and priorities coming out of that group. So.
And if you heard the real estate uptick on the news report this morning, how it's going up, it goes up every month. So definitely we do need more housing for all.
Mm-hmm.
People that actually can't take jobs here because they can't find housing here, it's a dilemma. And hopefully Senate Bill 391 is going to pass so we can have legal ADUs in Deschutes County at some point in time.
So is there a motion?
I move we sign the letter to the Meyer Memorial Trust Review Committee and trustees for COIC.
Yes, for COIC's Housing for All project, I second.
Okay. Any other discussion? Seeing none, Commissioner Adair,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes also.
Thank you.
Thank you. What's the next letter?
It's the roundabout.
Yep, okay, so I do have that one right here. So Sisters Roundabout at US 20 Locust Street intersection. Letter to Director Strickler of Oregon Department of Transportation advocating for planning of this roundabout and the capital needs.
Commissioners, this was a request made by the Sisters Council at the joint meeting we had several weeks back for this letter of support, and the board seemed amenable to preparing that letter. It took a while for us to get the suggested language from the city, but we did, and so the result is the letter in front of you today.
I'm supportive of the letter.
And so am I, of course. I've been talking about this with the ODOT for quite a while now. You know, it does seem to flow for Sisters on both ends of town, so. And it does help because that pass-through, when you head towards the airport and go around, it actually can be faster than going through the city of Sisters. So that will all work together.
Well, it definitely could be an alternate truck route, and then, just safety and flow for people that want to, possibly just get around town and know about it. If that second roundabout is there, it really provides the opportunity for flow in both directions. Roundabouts are, a preferred choice these days for traffic flow, but they do keep moving instead of backing up, so that's the opportunity. So, motion of,
I move we sign the letter endorsing the roundabout for Sisters presented by the Sisters City Council.
And I second.
any other discussion?
And the one other thing I would say is during our joint meeting with the Sister City Council, I was really pleased to be able to ask their Public Works Director, Paul Bertagna, about freight mobility through roundabouts, and hear him say, we have, each request that the freight operators have brought to us, we have accommodated and re-engineered, and gotten to the point where they're designing roundabouts that have more turn radius, more turn flexibility than some of the points along the highways that flow into Sisters at this point. So.
Yeah, so just some of the tight turns on the roadways themselves. I think down by Detroit Lake and stuff, there's some spots that get pretty tight. So these would be more open, more capable of taking that large, long truck for turning purposes.
Yeah.
And there's been a lot of analysis, a lot of history on that. I know they had the setup out at the fairgrounds years ago, just bringing in the biggest trucks they could to prove what does a roundabout, that needs to be, how big does it needs to be. In fact, I think that was before the Tom McCall roundabout in Prineville that they even brought that in.
And that was not perfect when it went in.
Well, yeah, so the curbs and, the turn radius, but they're learning. Yeah.
Well, the truckers would hope they have learned, because it's definitely, when you're driving a truck, and if we're going to have a whole string of roundabouts, it would be helpful if they were actually designed to meet their specifications.
For sure.
Yeah. So the work the work that the City of Sisters described, kind of going back and forth with the freight operators, it was great to hear about that.
Okay, so calling for the vote, Commissioner Dare?
Yes.
Commissioner Chang?
Yes.
And Chair votes yes. Thank you. Is there another one?
Commissioners, Whitney, I think, has a draft letter related to the judges she'd like
Oh, yep, okay.
to discuss.
Thank you, Commissioners. For the record, Whitney Hale, Administration. On Friday, during the board's legislative meeting, you discussed an upcoming hearing that the Joint Ways and Means Subcommittee on Public Safety would be having related to judicial funding. That will be, as you know, occurring today. And I know the commissioners, I think, plan to provide oral testimony in support of the need for additional judges in Deschutes County, but staff had also prepared a letter for your consideration, and so just wanted to check in on that. If the board would like to submit written testimony into the record as well, or if you'd like to simply provide your testimony that you plan to give today.
I think it's valuable to have, 3 signatures on a written testimony. So if we all support that, and thank you, Tom, for providing some words in there. I think it might have been feedback that, you had provided. So it makes a good, clear statement from Deschutes County's point of view that we just happen to be able to commit to, the future capital needs, which not all counties can do, but if that's a decision point for the legislature,
Yeah.
let's put it on the record.
I think it's great to have written testimony and oral testimony, and I studied the letter very closely last night and this morning while I was trying to put together the comments that I was going to provide this afternoon. And the one other thing I would say, kind of along the same lines as the theme of submitting a letter with all 3 signatures during the testimony this afternoon, based on all of your feedback that you would be watching. I intend to specifically say, who I am and that all 3 of us are here
Yeah, see, that's
in attendance. Yeah.
So I love it. I love the letter that it says our population has increased 57% because I'd been saying 55%.
Oh.
So I'm glad to see those 2 more numbers.
Still going up.
And then the other thing, yesterday I was told that we were up to 4.5 million tourists a year. I believe this was a couple years ago. So if 4.5 million tourists, and I know some of those seriously impact our port system. So yes, it seems like it's rather timely. It should have some weight here. The fact that we are such a tourist destination and the impacts. And some of them have to come back for court.
Great. So just acknowledging this is a letter to the co-chairs Gorsuch and Solomon, members of the committee of Joint Committee on Ways and Means.
I got a teeny little bit hung up on the phrase "one of the most under-resourced courts in the state" because, we have seen the numbers now, and we know that there are a few counties that are ahead of us in terms of kind of total ratio of cases to judges and need, but I do think it's I think the wording is fine. One of the most under-resourced courts in the state.
Yep. Well, it can be emphasized. One of. We agree.
Yeah.
There's others. Yeah.
Yeah.
So is there a motion for the letter? in this form?
Yes, I move we sign the letter for the need for circuit court judges in Deschutes County to the Joint Committee on Ways and Means.
I second.
Any other discussion? Commissioner Dare,
Yes.
Commissioner Chang,
Yes.
and chair votes yes.
Thank you,
Knocking them out today.
Thank you.
Thanks, Whitney.
So I just happened to notice Joe Sidoni might be in the vicinity if we want to possibly move one item. If it's about a 20-minute item, that might be valuable, but just looking for opportunities.
Did he stay here? Oh, thanks.
Get his presentation.
Oh.
Well, one other thing about the testimony this afternoon, I shared with Tom and Whitney, and I'm not sure if it made it to you guys yet, but that the Oregon Judicial Department staff were estimating that we would get through our testimony portion by 1:30. So
Yeah, so that's
that big chunk of time that we have in the afternoon, we only probably need half hour, 45 minutes of that.
So that was acknowledging that our afternoon session, our agenda is published for recess to allow for testimony, and we did set 3 o'clock as a safe time to reconvene. We do have 2 items, 3 o'clock and 3:15. So you're thinking we'll be done by?
Yeah, it sounds like it sounds like our opportunity to testify will definitely be done by 1:30, 1:45. So,
So is it possible to move our calendar up? Are we allowed to?
So yeah, my only thought is the land use item that may be of interest to some folks, so it's published at 3:15.
right, it's probably good to keep that.
Yeah.
Yeah.
So let's just leave our agenda at 3 o'clock for restart, just for that purpose.
Yeah, but just so you all know that
Yep,
you'll have a little break.
Oh, okay,
after-
there we go. Acknowledging. So yeah, we are in a spot where we've worked through our agenda, and we have a 10 o'clock start for a COVID update in support with everybody coming at that time. So we just happen to have Joe Sidoni in the room for our item number 7, rural broadband update. And if you think 20 minutes is appropriate on the topic, we could fit it in now.
We can certainly do that.
Great, thank you. And there's the slides and everything. Okay.
That's right. Thank you.
Thank you for joining us, and thank you for being flexible.
Yes. For the record, my name is Joe Sidoni. I'm the Information Technology Department Director for Deschutes County. Today we're going to talk about the problem of access to rural broadband for rural communities and underserved. Sorry, I have to get my glasses on.
Well, Joe, I want to thank you for joining us. We don't see a lot here, but I was just thinking that's probably a good thing. When I turn on my computer, it works. We don't have problems with, the systems going up and down or anything. So congratulations, you and your whole department. And you guys might work very hard in the background, but it works great from my point of view.
Yeah, we've been pretty fortunate over the years with having a lot of support from the county and have a very good department of staff over there.
Thank you.
So 2 topics that I'm going to talk about. One, the first thing is I'm kind of define what the rural broadband gap actually is. And then we're going to go on to a very brief discussion of some satellite technology that may help a bit in addressing the problem of access to rural broadband. So next slide. I guess I have the control here, don't I?
The wheel works.
What's that?
The wheel works.
The wheel. Oh, thank you very much. I'm not connected here, I don't think. There we go. I'll use the keyboard. Okay, so what is broadband in the first place, right? So broadband internet is high-speed data, typically to a residence. That's what we're concerned about with today. It involves a high-speed rate of data transmission. It provides access to the highest quality and the highest demanding internet services available. And access is constant, and that's important in the definition of broadband. It's not on-demand access. It's always on, like electricity. And the FCC has defined a rate for qualification for things like grants and awards and that type of thing, and that's 25 megabits download and 3 megabits upload speed.
So, let's take a moment and acknowledge that. So, because I see some articles and some media coverage about broadband deployment around the country and how some people don't have broadband relative to what's expected, or there's different ways it's termed, but that is the published National Federal Communication Commission speeds when we're referring to broadband, because it's like a speed limit or speed minimum, I guess, is what we're referring to, but 25 megabits down and 3 megabits up, and then also constant access, or
that is correct.
I don't know, is constant the right word there, or?
Continuous, constant.
Continuous, yeah, there you go, continuous access.
That's correct.
Because there can be systems out there, and because I've seen this, northern Klamath and northern Lake County, where there has been some internet access, and it's even, like a wireless connection that's not quite up to these speeds, so it's not counted as high-speed internet.
That is correct. And that's very important when we talk about funding at the federal level for rural broadband access projects, right? Because that's a minimum specification for a service provider. I want to touch on this quote in this next slide here. And I'm going to read it, it's the only quote I'm going to read today. It's this is from FCC Chairwoman Jessica Rosenworcel, who is the current acting FCC Chairwoman. She hasn't been confirmed by the Senate yet. And she stated in an interview that broadband is no longer a nice to have, it's a need to have for everyone, everywhere. This pandemic has demonstrated that with painful clarity. It's a very strong statement from a very powerful, or a very strong statement from a powerful position in the federal government, right? And it should be taken that the federal government is very serious about this issue, and we'll go on a little bit more about that, but more on the broadband internet gap. So we're going to talk about what it actually is. So since about 1999, the private sector and the public sector have been leveraging the internet more and more and more for the delivery of services and information and product. If we think back, it's not so much prevalent today, but around 2005, 2006, we kept hearing things like, e-cities, e-government, let's get on the internet and connect more with our citizens, right? So as we've leaned and as the public and private sector has leaned harder and harder on the internet for delivering product and services, the gap grows a little bit larger every time we do that. So think about that when you hear the statements, for more information, see our website or register online at such and such a website. What's happening there is that gap on one end of it, not the accessibility end, but the services end that they can't reach is growing. When you hear that. So who are the typical citizens that have access to broadband internet? From statistics, we know that they make more than $50,000 a year. They have some college education. They're younger than 65. They tend to be white. They tend to live in urban and suburban communities. So people that are outside of those statistics, or don't meet those statistics, are the people are the families and the citizens and the households that we're talking about in terms of being able to access broadband. They're more likely to have trouble getting access to broadband from a statistics standpoint. The FCC states that there are 7 million households that lack access to broadband. And why is that? Well, the main drivers are, first, cost versus revenues. Especially in rural communities, it's just not profitable for an internet service provider to build out to a location that has 5 houses. We can give them all of the money in the world. Let's say, for example, we give Ben Broadband all the money to build out to Brothers and establish services out there. But they're not going to get enough accounts to pay for their operating expenses. So what we're finding is that there are funds available, like from the Federal Communications Commission, to do these build-outs, but there's no incentive for these companies to actually do operations in these areas, financially anyway. The second is affordability. Your typical broadband subscription rate is somewhere between $50 and $100 a month, right? That's more than water and sewer for most people, right? It can be unaffordable, and typically what we find, especially from for lower income population, they substitute cellular data or the cell phone subscription for broadband, right? Which doesn't necessarily meet all of their needs, but that's the give that they see. And then there's also a not significant, but a notable portion of the population that's just disinterested in the internet, or they lack knowledge of what services that there are in the internet to be offered to them. Right, and so that is some of the drivers for this. So, underserved communities, what are they missing? They're actually missing a lot, right? Public entities especially leverage the internet for education, medical, financial services in the private sector, employment services, legal services, all sorts of services from the government, and a variety of social services. For Deschutes County, we're actually not doing too bad. We're pretty close to being the best in the state for coverage for broadband internet. In other words, we have several providers that meet the minimum specification for broadband internet, and they're readily available in most areas. Our coverage from the statistics that I have says that it reaches about 88.6%. So we're looking about one in every 10 households has a problem with accessing broadband internet. For Oregon, the average rate is about 86%. For the U.S. in general, it's about 83%. Globally, it gets a bit worse in that the rate is about 55%, and I've seen numbers that are much lower than that.
Joe, do you have kind of like a spatially detailed sense of what parts of the county lack access?
So typically, you're talking rural areas out on the fringes, and East County is specifically underserved. So as you leave the city of Bend and head out towards where the lot sizes get huge, right? You know, we're talking very underserved areas that basically only have satellite internet, which is not the best option if you've ever had to use it or experienced it. I read an article recently in the Salem Reporter where Lapine was one of the, and the Lapine, Ben Lapine School District had a serious problem, had struggled with getting education, getting kids educated in the rural areas of Lapine when they just couldn't come into school, right? And they had no access to broadband. They had little access to cellular, which means that the hotspots that the school district may have provided them were spotty at best. And then we have the outlying areas, say, north, west, south of Sisters area, where you know, you have people that chosen to live out in the woods, basically, and we just have infrastructure issues out there, right, in some areas, and that's basically due to an issue where when we plan these communities, we don't necessarily plan on internet. We let it take care of itself, and sometimes it just doesn't, right? And so I, for example, live in Tetherow Crossing, northwest of Redmond. And we're on the very fringes of where Ben Broadband covers. Now, Ben Broadband does a spectacular job of covering a huge swath Central Oregon. However, their service capabilities are not necessarily everywhere. Out where I'm at, I'm out on a very fringe of their service area in that particular area, and my service has been spotty ever since I moved out there 13, 14 years ago. And so mainly we're talking outside of the urban areas in Deschutes County, and actually out on the fringes, the outside fringes of any of the municipalities is where our underserved areas. So what can be done? Well, and these are essentially, from my opinions, and I've gotten input from other various sources. But one of the things that's very important is we have to look at broadband as being a necessity versus a luxury. For too long, we've not considered it an essential service, not critical infrastructure. For our citizens. It's not water, it's not sewer, it's not necessary. Right? And if we as government or even the private sector are marketing to or providing services for over the internet, then we're responsible to making sure that they have access to those services, everybody equally, in some form, in part. We have to realize that the private sector is not going to solve this problem. It's a profit motive issue. Again, as I stated, we can give them all the capital in the world to do the build-outs, but unless we somehow subsidize it and allow them to have to continue to make money and not lose money in those areas of service due to operating costs, which are very expensive, by the way, then they have no interest in doing these build-outs.
That's kind of I would say, 80-20 problem for business, but it's almost getting to be a 90-10 problem too, because of 88% coverage. But yeah, so that last 10 to 20% is just not ever going to be profitable.
That's right.
Joe, last weekend, I actually took my granddaughter, who lives in Los Angeles, who has been having continual power's been turned off. If the wind's 12 miles an hour, they shut their power off where she lives, which is can be quite impactful. You've got to have your own generator system if you're going to be having that kind of deal. But I took her to my mom's house in Eastern Oregon, and oh my gosh, there is no internet there.
Yes.
She's been there before, and because she is only 15, she is like, this is, Grandma, I can't believe you could actually stay here without internet. And I go like, there is something about it that some people do make that choice.
Absolutely.
And yes, so I just thought, but it's good for her to see that, okay, Chloe, you don't always have internet.
That's right.
And there's, this question of kind of where, what the private sector can do and where you need the public sector to step in. We can think back to the, in U.S. history, to the rural electrification project, to the construction of the federal highway system. Those services were not built to places where there was lots of customers. They were built to enable settlement of areas so that there would be lots of customers later on. And when we think about rural broadband, I think that's an important way to think about this. You look at what the private sector does in the internet world, and in urban population centers, there's tons and tons of it's incredible redundancy of investment to compete for customers, while we have these other areas where there's not a density of customers and there's nothing, there's no investment.
Right.
And we've seen we're actually I've had the opportunity to watch some of our neighboring counties to the north, are a little bit, not exactly neighboring, but close to neighbor counties in Wasco County, Sherman County, and Gillum County, make substantial local government investments and help to secure federal and state resources to be able to expand broadband access to the most remote rural portions of their counties. It's incredible what that's enabled in terms of commerce, telemedicine, education, all sorts of other things. So,
Absolutely.
Where I'm going with this is we've heard that broadband is going to be one of the eligible infrastructure expenditure areas for the American Rescue Plan funds that the county will be receiving. So, I just want to plant a seed right now that I think that this could be a very strategic place for us to put some of those funds.
Yep, that's great. Rural communities are at a distinct disadvantage when it comes to, especially when it comes to economic growth. If businesses, whether they're existing and growing or looking for relocation, if they don't have access to broadband, they'll go elsewhere to find it. All right, and so
we do have an item for 10 o'clock now. Now I feel bad that we're just getting to the meat of this. Do you want to possibly come back in an hour or hang out for an hour, or? 'Cause we got, yeah.
I can, because I'm actually going to go on to topic number 2. And so if we want to.
Yeah, because I'd love to talk about this a lot longer.
Yeah.
I can do that.
So let's do that. So we're going to switch gears. So that was half of item number 7, rural broadband update. Got our juices flowing on the topic. And we do have a COVID-19 update, item number 6. And we'll get back to that. But yeah, if you're available after, right at 11 o'clock, your published time, we'll get back to this.
I will be. Thank you.
Thank you so much.
Thank you so much, Joe.
As I say, we got halfway there. Okay, so at this time, we're going to go back to item number 6, COVID-19 update. We do have a set of slides provided by the Health Department. We're going to switch gears back to Dr. George Conway, Molly Wells-Darling, Nahad Sadara-Zodi.
Yes, good morning. Give me just 10 seconds. I'm changing a setting here.
Not a problem.
I'm actually going to do slides and present along with Molly Wells-Darling, our Deputy Incident Commander, who will be ascending to being the Incident Commander sometime in the future. Nahad is very busy with our preparations for our budget orientation session tomorrow, so he won't be involved in this today. He has been helpful in putting it together. With your permission, I'd like to share slides.
Yes, so we do have slides up from the last presentation still, so there we go. And
so do you see a title slide?
yes.
Okay, great. So the division labor, I'll talk through the statistical slides, and then I will also talk a little bit about a recent problem that everyone's heard at least about on the surface. And then Molly will cover all the rest of the vaccination information. So good morning, Commissioners. This is just 2 reminder slides at the beginning. We remind everyone, and there'll be another slide about this, that basically everyone over 16 and over will become eligible for vaccination starting on Monday. You can go ahead and register now, get in the queue. And this is the site, centraloregonvaccine.com. And then a reminder in case people have missed it and do want to get COVID testing, there is an event taking place in downtown Bend today. It started at 9, goes till 2. And you can, if you're interested, just go on Deschutes.org, COVID testing, and the directions are there.
So, Dr. Conway,
yes.
Conway, on the testing event, just for your information, we did have public input today asking us to stop free testing sites. We don't need to spend money on that. Please help get the county in Oregon opened up. So if you have any kind of a statement about how valuable the testing site like that is at this time, that would just help respond to public input we had.
Well, we want to have testing available at the lowest barrier possible, and this is one of the many outreach efforts to do that. There's no reason why making testing available would drive up the number of people infected. If more people learn their status so that they can take precautions, that's helpful.
Yeah, I mean, I would just say that testing is the way that we find COVID in our community so that we can contain it, so that we can bring the cases down.
Yep, just acknowledging. Thank you so much.
Okay, well, thanks for bringing that up. It's not the first time we've heard the sentiment. We heard it very early and often in the pandemic that the testing and identifying cases was the reason that our statistics were up. And I think it's difficult to defend that perspective now. This is key information. That's one of our ways out of the epidemic is to understand its dimensions and its progression and contain it as quickly as we can. And once again, you'll see on this slide that we have had a rapid recent increase in cases, but we're still committed to doing everything possible to contain the pandemic while we're trying to vaccinate our way out of this circumstance. So going to this, we have had an almost doubling of case numbers in the last week from 150 to 282. And as often happens, hospitalizations are a trailing indicator. We have seen an uptick in hospitalizations in the last few days in the St. Charles system and in the county.
Is the hospitalization chart available? I didn't see it in here.
It's on the screen. We were updating it. There was a problem with the graphic that we're updating, so I'm displaying it. It's not in the set. It wasn't ready when we sent the set downtown.
Okay,
Be happy to send a copy to follow.
so there it is.
Oh, yes.
So Dr. Conway, what is the mortality rate that has now been recognized since COVID's been going on for over a year?
Well, it depends on which mortality rate you're talking about.
Locally, nationally, state, or?
Yes.
I don't have any of those statistics in front of me. I'd be happy to come back with that. It changes over time.
Okay.
Because it's the real time number of cases as the denominator, with the number of deaths as the numerator, or we can do overall population mortality, and they're both tracked in real time. I'm sorry, I don't have those current in front of me.
Okay, do you have
It's certainly
the number
an
of
aggregate
Deschutes County in accumulative?
Pardon me?
Do you have the number of Deschutes County residents accumulative through today or yesterday? Do you have that number available?
Yeah, it was in the upper left of the prior slide, so 6,759 cases,
Deschutes
72
County
deaths.
in the hospitalized Deschutes County people.
I'm sorry, would you mind asking the question again, please?
I'm sorry, I'm wearing a new mask today and I think it's thicker. How many people from Deschutes County have been hospitalized in St. Charles accumulatively?
We do have that. I do not have it. I do not have it in front of me.
Okay.
We'll be happy to follow up with that. Making a note. And at the end, when Molly's giving her presentation, I think I have St. Charles data that I can look up while she's talking about it. And I'm writing down about death rates. We'll follow up on that. May I go on?
Sure.
So there's a lot of interest in where these cases, new cases are concentrating. And this is a slightly complicated slide. I think I showed a simpler version of it last week. So each of these groups of bars are for an age group. So 0 to 9, 10 to 19, 20 to 29, 30 to 39, up to 49, 59, 69, 79, and then we break out 80 to 84 and 85 plus. And the reason we do that is early in the epidemic, there was a very high concentration of cases in the long-term care facilities. Now, the pandemic is moving much more toward younger, more active people, and I'll talk a little bit more about the if you will, risk factors in a moment. The leftmost bar in each set, the light blue is from basically a month ago, and then this is these 5 weeks. and you can see there's a sharp increase, the dark blue, and that's been concentrated throughout people below 50, with the highest concentration in individuals or young adults, 20 to 29, and actually a even slightly higher relative increase among those 30 to 39, 40 to 49, and teens in this last week. So the concentration is definitely in younger up to the sort of shy end of middle age. And there's been sharp increases there with much sparing of, we're hoping that the sparing of the upper ages is because of high vaccination rates in these ages. As one might expect, our number of tests positive have gone up. And Commissioner DeBona, I do want to point out that we're glad that there are it's possible to organize some mass testing events, because actually the total volume of testing in the community has gone down recently at the same time that the positive rate has gone up. So we would like to have fairly consistent testing numbers across the board.
Dr. Conway, so the people,
Yes.
We've got these very high positivity rates, and we have lower numbers of people coming in to get tested. Are most of those people coming in to get tested feeding into testing through contact tracing and case investigation, or why are people? Why the small number of people who are showing up for tests? Why are they coming in to get tested?
There's multiple reasons. One is that they're testing because they believe they've been exposed. There's quite a bit of testing going on now because of travel requirements. So one would hope that those test results would be relatively low. And then there are individuals who are being followed up as contacts. The infection rate in contacts hasn't been extremely high, though, so I don't think that's the main thing feeding it. In many countries, and only in very few places in the United States, such as some university campuses, and a few school systems, there's no regular cross-sectional assessment of the prevalence of COVID infection in communities. And that's why we did trace last May in Bend, and we did it in Redmond in the end of January. So that's the only way of getting a much better approximation of the actual prevalence. And you remember that Redmond had it's almost a 3% prevalence, which is quite high. So we don't actually know the true prevalence, so there isn't anything to benchmark this against. So who's tested is whoever shows up and asks for a test. Now that's partially inflated by people doing pre-travel required testing, and the number is inflated, and that may bring the rates down. And then the rates could go up as a result of more contacts being tested. But there's no strict accounting of that. And when individual providers do testing, there's no requirement for them to report risk factors or to survey the client on why they're being tested and pass that along to us. Good question, though. It's an important question that unfortunately continues not to be well answered at least in our nation. So we're now well into the high range for risk level, and you can see that this is time is most passed here and then moving up, and you can see this last week we're quite far into that range now, averaging that over 223 cases per 100,000 accumulated over a 2-week period. So we're well into that range. We certainly would prefer not to see things that way.
Dr. Conway, can you
yes,
can you tell me what the threshold is for the extreme risk category? Like how close are we to that?
Well, there's a double-barreled criterion that I haven't committed to memory, but there has to be a persistent testing rate over X along with the prior threshold and I don't recall, I think the prior threshold was 400, but I'm not sure. I don't have it in front of me. But there are new criteria. I'll be happy to send that to follow. So they've made it much more, basically there's a higher bar to be put back into the extreme risk, and that was based on a lot of expressed concerns by counties as well as businesses around the state. So it's a higher bar because there's two criteria that must be met at the same time.
Thanks.
I'll be happy to follow up with that.
Please send that. Thank you.
Yeah, I think that the governor's office, I think it was Lauren Liba sent that out, and I thought it was discussed. I remember it was going to be discussed at the commissioners' meeting last Friday that AOC arranges, but I don't think that meeting ended up occurring because of some conflict.
I
So
don't
I'll
have
be
that
happy.
information.
No, we actually had a national meeting, well, just for Oregon that day.
So I'll be happy to forward that. There's an OHA document about that. So we're going to move along to risk factors. I'm going to sort of prime this, and you'll forgive me if it's repetitive, that we continue to emphasize hygiene, face coverings, maintaining space, and now, especially as it gets warmer, fresh air. This is a little bit about what we know about the new recent cases. We know that I've already talked about the age distribution. There are often extracurricular activities where safety measures are removed, like people not wearing masks during sports practices. Number of the outbreaks that we've seen have been in workplaces. We've seen a number of them in daycare centers recently. And then people go out and socialize outside of work, presumably before they find out that they've been infected with COVID. And quite a bit of that appears to be occurring without mask wearing or distancing. There's travel-related exposures, and that's why the Centers for Disease Control is recommending only, necessary travel. And they count in that if it's been a year since you've seen your grandkids or your grandparents, that could be deemed necessary travel. But they're really asking people to delay just simple vacation and other leisure travel without some underlying reason. Carpooling can be a real problem if you don't have the windows open and people aren't masked. Then that's an enclosed space, a small enclosed space, and then barbecues and outdoor events without masks and distancing. And this of course, this last scenario is very similar to the first big surge we saw in our county that involved both young people and a broad range of racial and ethnic groups, and had a selective high attack rate in the Hispanic community, which actually is not what we're seeing now. This is primarily young people in general, and not concentrated in any particular ethnicity. So once again, wearing a mask, social distancing, and scheduling your vaccine. And then one other thing, I think I've shown this before, but just a reminder, we are into allergies season. You may have heard me coughing or clearing my throat. It's just a reminder that the sort of cardinal symptoms that often present for COVID-19 are fever, cough, body aches, headaches, tiredness, loss of taste or smell. All of these are similar to flu-like illness. The loss of taste or smell is really fairly unique for COVID-19, and shortness of breath. So if you're feeling a lot of these all at once, there's a very strong chance that it's COVID. On the other hand, if you're having some cough, perhaps a headache, fatigue, and then you have a sore throat, sneezing, itchy or watery eyes, or runny or stuffy nose, it's probably not that. It's probably allergies, especially if you have a history of allergies. So we want people to think about if this is the time of year that you usually cough and sneeze. And you probably don't need to be seeking attention if you're just coughing and sneezing, or if you have so much mucus you're producing, it's making your throat sore. On the other hand, if you're really achy and you've lost your taste or smell, and if you're becoming short of breath, whether or not that's from COVID or allergies, it would still be prudent to seek medical attention. So the last thing that I'll talk about, and I'll move on to Molly, is we have had some concerning news in the last few days. Today, actually, there's a meeting being convened by the Advisory Committee on Immunization Practices that CDC runs, but there'll be it's sort of a collective consultation because I think it was Monday, the FDA paused administration of Johnson & Johnson vaccine to review 6 reported cases of blood clots. And these were serious but very rare complications. There have been 6 that have been reported. Unfortunately, one of the women, it's been women from 18 to 48, one of them did die from this extension of a blood clot in her brain, who had received the J&J vaccine or the Janssen vaccine. Johnson vaccine. So these 6 cases of
Coming in, yeah.
really dire, bless you, really dire side effects have occurred, but less than 1 per million. So they have put a hold on this. And I should point out that the Janssen vaccine or Johnson & Johnson vaccine is a very similar design to it uses an adenovirus, which is a deactivated or actually non-pathogenic common cold virus that has a DNA snippet that it introduces into human cells to induce the same process as some of the other vaccinations to induce immunity. But that's a similar design to the Oxford AstraZeneca vaccine, which was pulled and stopped vaccinating for a brief period of time in Northern Europe, maybe 2 months ago, and is now back in use in a number of those countries, but some countries are still not using it. So since none of this has been detected in the mRNA vaccines, the Pfizer and Moderna, there's no general concern about this, but there is a specific concern that there may be certain groups, and we know just demography, women between these ages, so basically reproductive age women is where this has been concentrated. And there's an effort to look and see whether or not that group can be asked not to receive this vaccine, or whether there needs to be a more general hold while more information is gathered. And I understand that's the purpose of today's meeting, is whether or not it's possible to put out a risk statement and segment the potential recipients, or whether it's necessary to just hold everything for a while. And hopefully we'll get some readout on that in the next couple of days. I should point out that our mass vaccine clinic at the Fair and Expo, we're only administering Pfizer and Moderna currently, so there isn't any expected impact on scheduling. And then I just mentioned that there's been no similar risk associated with those 2 of the vaccines that are the primary ones we're using. And then just an enumeration of what we've administered so far, what collectively all of our partners with our assistance and support is we've administered almost 83,000 doses of the Pfizer vaccine, 37,500 of the Moderna, and about 3,000 of the Janssen vaccine. And now, unless there's any pressing questions, I'll pass along to Molly to talk about our whole vaccine process and where we are and where we're going. Molly.
Dr. Conway, could I circle back on
Yes.
the Johnson & Johnson reactions? So you mentioned that is a very similar design to the AstraZeneca. And I know that the AstraZeneca, there was some pauses associated with reactions that people were having to that vaccine. But I can't remember what kind of reactions people were having to the AstraZeneca vaccine. Was it also blood clots?
Yes. There was a concern about blood clots, and there's a clinical association with a disturbance in platelet counts. So platelets are the tiniest of our blood cells that help with the clotting cascade. So appears to be a malfunction of the platelets that may contribute to the clotting or clumping. And then that problem with that is if you have a small clot, then the blood can back up and infuse into other parts, specifically the brain, and cause damage. So yeah, the mechanism as described there was very similar. I don't recall there being any specific demography because of course at that time the primary recipients of vaccine were elderly persons in the Northern European countries where they were administering Oxford AstraZeneca, and the frequency of that complication was not as high in the UK as it was observed in some of the other countries. What WHO has done is recommended continuing use, particularly in the high incidence rate countries, because the risk of this complication is hugely lower than the risk of acquiring COVID, and that's the sort of, if you will, difficult or painful logic that we could be facing in this country if we had that sort of problem with the primary vaccines that we're administering. But as it is, the primary vaccines we're administering are a quite distinct design, and we're not aware of any serious problems with this.
Great, thank you.
Sure. Molly, I guess I'll keep driving. So I move to the first slide?
Yes, please. Thank you. Good morning, commissioners. This is the slide that we've seen before on our vaccine data. So as you can see, Deschutes County is still dark blue, which means we're one of the leaders in the state for vaccinations of our population. We have vaccinated 50,000 fully vaccinated, and close to 26,000 people are currently in the vaccination series. This week at the Mass Vaccination Clinic, we will provide close to 8,795 vaccinations. 5,295 will be the first dose, and 3,500 will be second doses. You can go ahead, George. This is just another way to show where we're at with our population and our goal of 80% of our population being vaccinated. So we have close to 50,000 who are in progress, and then we have, 26,000 in progress and 50,000 who are fully vaccinated, for a total of 75,893 individuals who have received vaccine in Deschutes County. Go ahead. So the good news is that we are through Group 7 almost. We have filled up almost all of our appointments this week with our people who are eligible for Group 7. And on Monday, we open up to everyone, which is very exciting. So sometime this week, once we get all of our current appointments filled, we will then switch our pre-registration form so that we're not gathering the medical information any longer or the occupation information. It'll be a much simpler version. People can go on and pre-register and then get that link sent to them when a vaccine becomes available. But currently, people who are eligible are our frontline workers, which is basically anybody who is public-facing, working with the public within 6 feet of them, or spending more than 15 minutes within 6 feet of a person, as well as multi-generational households and adults, individuals 16 on up who have underlying health conditions, and also household members of frontline workers. So if you do go on and pre-register today with the hope of getting a vaccine appointment sent to you for this week, you'll want to really highlight that frontline household member of a frontline worker, if that is what applies to you, and that is located in the occupation section of the pre-registration. You can go ahead and move forward. This just goes over our underlying health conditions. I think most importantly in here probably is the BMI, just that lots of individuals may not realize what their BMI is, so they can go online to a BMI calculator, put in their height and weight, that'll tell you, and if your BMI is 25 or higher, you do qualify. Everything else in here, when you go onto our form, you click on what underlying health condition you may have, and then it sorts it out for you. So that is available through this week, and then next week will be open to everyone. Go ahead, George. So just a reminder to pre-register for your COVID-19 vaccine at Central Oregon COVIDvaccine.com. That pre-registration form is available at any time. This is the fastest and easiest way for people to pre-register. And what happens when you pre-register is you'll fill out that form and it will have you in our system. When you become eligible, which everyone will be eligible on Monday. Then as we get vaccine in, we will be sending links out to those eligible individuals in the order that they have signed up. So get in there, sign up, and then when your turn comes up, we'll be sending you that link. Remember to look in your spam folder just in case it goes there, or to add it to your address so that it comes directly to you. Also, if you receive a vaccine appointment link, you have 48 hours to fill that out and take advantage of your appointment. If for some reason you've already gotten your vaccine, that's fine. Don't worry. You can just ignore it and it'll take you out of the system. If for some reason those particular appointments do not work for you, then please just make sure to pre-register again. Again, the process will be very simple, much simpler at that point, so that you get your name on that list again.
Molly, just a fine point. So when we say that everyone's eligible, so once again, that's 16 years and older, and it is important to still put in your age, because 16 and 17-year-olds can only be vaccinated with the Pfizer vaccine. So, and there are trials that have actually being closed out for 12 through 15-year-olds. We're hoping there will be licensed vaccine very soon for them. And then there are trials in both Moderna and the Pfizer North American trials from 6 months up to age 12, and we're hoping that those will be completed sometime this summer, so that we will actually be able to vaccinate everybody other than newborns by sometime in late summer or fall. Sorry to interrupt, Molly.
No, that's great. And to that point, actually, I'm glad you brought that up. It's really important when you get your link, if you are 16 or 17 years old and you receive a link, you want to be very careful about which day you're signing up for. So you want to sign up for a day that we have Pfizer, so that you make sure that you're going to get the right vaccine. But if you show up when we only have Moderna, we're not able to give Moderna. So just really, it's in there. It's fairly clearly written which days we're running which vaccines. So please, if you're 16 or 17, sign up for Pfizer. And then also just a reminder to the public, if you are coming in on a day where we are running more than one vaccine, we cannot promise which vaccine you will get. Because we try to run those vaccines where we start with one vaccine and then we transition to the other, so that we're very clear in the distribution of the vaccine, making sure there's no mistakes. So those are just two things to really pay attention to when you get your link and you sign up for your appointment. One other thing in relation to appointments, if you receive your first dose at a pharmacy or somewhere else, you really need to receive your second dose at that same place. So if you go to Safeway and you get your first dose there, you should return to Safeway and get your second dose there. We do have second dose appointments that people can basically register for on our pre-registration form. There's a box where you can choose first dose or second dose. And when you choose second dose, then someone at some point will be calling you to get you registered for those second doses. So really those are for people who just absolutely had to cancel their second dose appointment. We really encourage you not to do that, because it's, it's difficult to get you back on the books. However, if you need to, you can go to that second dose button and press that. And then it's also for people who maybe were out of the state and got their vaccine in another area and then moved to Oregon and are getting their vaccine here. So go ahead, George. This is what you'll receive. So after you pre-register, this is what you will see to know that you absolutely are pre-registered. You're all set. You will not get a confirmation email. You do not need to go in and pre-register over and over again if you've received this statement. Because it would be good to take a picture of this to have it with you, but just know you don't have to go in over and over again. The only time you would have to go back into pre-register is if you received a link for an appointment and for whatever reason you couldn't utilize that link and you want to get back on the list. Go ahead, George. So you'll receive an email when there actually is a link available for you from St. Charles. Do not reply at stcharles.org. That link, again, expires in 48 hours. So when you get your email, you can just press that link and schedule your appointment. It is good for people, if they can, to do this on their computer as well as the pre-registration on the computer. It's just an easier process on the computer. If for some reason you have an issue with your link, you certainly can call our hotline, and I'll get to that, I think, in the next slide here.
So,
Nobody will
Molly,
call. Yeah.
Oh, just a fine point before we go to the next slide. Have a do not reply as a prefix do sometimes end up being relegated to spam. So one thing that you might want to do if you've registered but you haven't gotten this is just check your spam filter daily to see whether or not there might be one that's languishing there.
Absolutely. Thank you. And just a note with that as well, you should not be receiving calls from people asking you for money or asking you for your social security number. We would not be doing that. So if you get calls like that, please do not respond to them. You will receive a link or via email or text. Or if you're someone who has doesn't have access to a computer or who has difficulty navigating the computer, you can call our COVID hotline to get you pre-registered, and then they would be the ones that would call you back when a link is available. I just want to highlight that really the fastest and easiest way to get pre-registered, again, is through that website because of the high volume of calls that we get on our COVID-19 vaccine hotline. But this is available for people who don't have access to computers. So help with questions, probably the quickest way is to also go to our frequently asked questions at Deschutes.org, COVID-19 vaccine. You can also email our health services at Deschutes.org if you have a question, and you should receive an email back with the frequently asked questions automatically. If that doesn't answer your question, someone should be in contact. We have a team of individuals that are watching for those emails. And then finally, the COVID-19 vaccine hotline is available if those two avenues don't get your question answered. Go ahead, George. So this, I just wanted to highlight our volunteers. We've talked a little bit about it in some of the other meetings, but they really are what makes this this clinic work. And this is the fastest and most efficient way for us to get our population vaccinated. And we are so thankful to our volunteers. So I want to give you a few stats. Just say it's per shift, it's 115 volunteers that work this clinic. So that means 230 volunteers a day that are out there making this clinic work, and they are amazing and they make it fun. In the last 6 weeks, we've been gathering statistics. So just a couple of those statistics, volunteers have clocked over 10,700 hours at the mass vaccination clinic. And several of our volunteers have over 100 hours of service, which is equal to about between 13 and 15 shifts. We have volunteers from the age of 20 all the way on up into our older adults. So a big thank you to our volunteers. They are amazing. And also wanted to say that we do need more volunteers, especially as we go into providing more clinics per week. So if you're interested, you can sign up at Deschutes.org Public Health Volunteer. And we will process your application and then get you connected with our volunteer coordinator to sign yourself up for shifts.
Molly, it's Commissioner Adair. Yeah. And last Thursday morning, I went early to the vaccination center. And I think it must have been Sisters' Day at the vaccination because almost everyone I ran into that was volunteering was from Sisters. It was quite amazing. The feedback was wonderful from all the people that were there. I met a retired dentist, I believe from Black Butte, and he was giving vaccines. He said, hey, we got to get through this, so that's why I'm doing this. And people were so happy to be helping. So thank you for coordinating that and making the operation so smooth and successful for our community.
Actually, I'll testify to that. I'm trying to pull at least one shift a week there as one of the medical officers on duty, and it's a very rewarding experience, and it's very convivial. So there's nothing for anybody to be shy about volunteering. Independent of your skill set, we can find something where you'd be very, very helpful for people. Thank you.
Yeah, I'll just say I have a family member who volunteers out there, and they said if they could be out there every single day, they would. They absolutely love it. So it's typically very fun. And again, we could not do this without our community and our volunteers. So just huge thanks to them. If you know a volunteer, say thank you because they are the key reason that we're getting people vaccinated in our population. Go ahead. think there's maybe one more, or is that that is the last one? Yeah. Questions?
No, go ahead.
Well, I just wanted to share that I am coming to get my first vaccination shot on Friday, and I signed up through the pre-register system, and I wanted to mention that because we have heard from so many constituents about the challenges of getting registered, and I know that our system for getting people registered for an appointment has evolved and adapted and improved so much over the last few months. And I just wanted to report I had a very smooth process. I signed up. A couple of weeks later, I knew what to look for when the email came, because I had seen it in the PowerPoint presentation a couple times. But when I got the email, I was very excited. Got signed up. Like literally during the time that I was signing up, the appointments I was interested in kind of disappeared, and I had to go to a second choice. But I was able to get in during my 48-hour time period, and I'm looking forward to seeing you all on Friday.
Great,
Commissioner,
thank you.
You may be relieved that we're no longer requiring people to recite their however many digit long confirmation code it is.
I printed it out, so I'm ready if needed.
Good. Well, making progress, acknowledging again the numbers are up. This was a post-holiday. It looked like we were coming down, and it didn't stay down. So this is still serious business in our community. But it looks like, seeing that skew of numbers from elder to younger, it looks like there's good cause and effect for the vaccines that are being put out there. So it's exciting to know that, there's action to be taken, and we're all doing it together. Anything else?
If I could ask one more question. So, it's really interesting to kind of look at the cross section of our community by age and see where the cases are. I am wondering if COVID is geographically spread pretty evenly across our community, or whether we're seeing in the I think they keep the data by zip codes. Whether we're seeing that there are basically areas where outreach and encouragement of people to take precautions is more needed.
Yes, Commissioner, we are tracking that. There is a higher case incidence as there was a lull, but there is a high case incidence rate in Redmond, and the primary other elevated areas outside the incorporated portions of the county. We provide, happy to provide a much more detailed briefing. To do that, it'd be better to do that in camera, because we can talk about the smaller communities and that level of detail.
Great. I'll follow up and ask for that information later.
Sure, we do track it though, and we're actually adjusting outreach, and we're also trying our best to do, and Molly can talk a little bit about this, pop-up clinics. So and of course, Mosaic Medical and the FQHCs at La Pont Community Health Center are trying to do outreach to the sparsely covered populations. There's been outreach to try to evaluate whether or not to provide mobile clinics to some of the homeless concentrations like Hunnell Road and Juniper Ridge, et cetera. So we actually look at that data and use that as part of our determinants of where to try to concentrate the more distributed and pop-up services. Molly, do you want to comment on that?
As Dr. Conway stated, we have Mosaic and then La Pine Community Health, who are both FQHCs, and they have different criteria, expanded criteria, so that we can get to our vulnerable population. So they are receiving allotments of vaccine directly. and providing services to those vulnerable populations and populations that can't get to the fairgrounds, et cetera. Mosaic is doing a lot of work for our Latinx population as well as our homeless populations. And then we are also coordinating with Mosaic to get homeless camps, out to homeless camps and to other congregate sites for our homeless community to make sure that we are getting as many people who want vaccinated to keep the spread from happening in the community. In addition to that, we will continue to do pop-up clinics in different communities. I don't believe we did any this week because we had some lower doses in vaccine, but we do plan on doing that as we see the vaccines come back at a higher rate. And we'll get especially out to those communities who are having a harder time getting out to the clinic or who have a higher number of vulnerable individuals in those communities.
And I don't remember if we mentioned it today, but the entire system is configured so that there's no direct charge to the person receiving the vaccine. If you have a regular provider, or if you have some sort of arrangement, insurance, entitlement, there may be some behind the scenes billing and whatnot, but there's no circumstance in which someone will have to shell out money to get a vaccine.
Great. Thank you.
Okay, thank you very much for the update. Just a few weeks ago, we were thinking of trying to do this every other week instead, but this is appropriate in these times. Thank you very much for the great information.
Thank you.
Thank you. And if you
Thanks
want
very much.
Thank you.
if you want to send us the mortality numbers later, that would be great.
I'm sorry.
The mortality numbers, you were going to send that to us, I believe.
Yes. I have a list of the cumulative hospitalization death rates for Deschutes County in the U.S. and then the new criteria for extreme risk, and we'll follow with that.
Thank you.
Thanks very much.
Thank you.
Have a good day.
Okay, so we'll get back to item number 7. We were spinning up on this topic right before that, so it's amazing the topics that we touch and make decisions on here at the board. So thank you very much, Joe Sidoni, for coming back with us about rural broadband update.
Oh, you're very welcome. I certainly appreciate this opportunity to present. I know I don't do so very often. So if I could get the slide deck that I had back up. Thank you. Very much. Okay, so to continue with part 2, again, my name is Joe Sidoni. I'm Information Technology Director for Deschutes County. To continue with the topic, we were talking about what can be done about addressing the issue. And one of the things that that I found in my research is that there's a big drive to get at the state level to establish task forces and funding structures. And that's because the FCC over the last 7 years has appropriated or has been appropriated over $40 billion to address this problem, but they've had a real issue getting that money out the door. And the real issue is that they were pretty much for the last several years leaning on the private sector to get this done, and the private sector just didn't have a whole lot of interest, at least the big players in the industry. There are 7 states in the United States currently that have legislation regarding addressing directly the rural broadband issue. One of those states is Washington. In 2019, they passed the Statewide Broadband Act with the goal of universal broadband in Washington State by 2024. That's pretty aggressive. Out of that, so when we talk about funding structures, this act essentially allows a state to tap into these federal dollars to create loans and grants internally into the state to both private sector and the public sector to help meet this issue on a more local level. Some of the things that they've done on a statewide effort is establish an emergency broadband benefits, basically a subsidy for the citizens to be able to afford broadband. To address access to broadband during the pandemic, they created drive-in Wi-Fi hotspots, for people to be able to access broadband Wi-Fi from their vehicles in order to be able to do business. They have the Public Works broadband construction grant and loan cycle. So those are grants and loans for internet service providers to do construction relating to servicing broadband in underserved areas. And within that, they have the Rural Broadband Construction and Planning Fund with a goal of providing high-speed open access broadband service to underserved areas in Washington communities. So it's a very, very aggressive legislative effort to address this issue in the state of Washington. But again, I just want to mention that there's only 7 states in the country that have legislation like this, and it's one of the best ways for a municipality to get the funding and what they need to address the issues locally. I also want to mention, before we go on, that we talked about. We talked about who in Deschutes County, from a geographic standpoint, is underserved in terms of broadband. I also want to make sure that we mention that underserved includes those who just can't afford it, right? And that's something that would need to be addressed over time. So we're going to talk a little bit about some technology that's exciting for a tech guy if you're interested in the internet and whatnot, and it's been in the news quite a bit. You've probably seen some of it, but the technology involves what are called low Earth orbit satellite internet. Now, satellite internet's been around for a long time. Satellite internet was developed in conjunction with television services such as Dish Network and DirecTV. They're basically the same types of satellites operating at what's called a geostationary orbit. And those satellites are about 35,000 kilometers out to be able to achieve what's called a geostationary orbit. They have to be that far out. The problem with traditional satellite internet is that there's a latency that's introduced to be able to get the signal out to the satellite and then back to the end user, and then back to the satellite and back to the source. And the latency is essentially the time it takes for that signal to get from point A to point B. And a geostationary satellite, because it's 35,000 kilometers out, it adds about a half a second of latency to the transmission. And so you have the normal latency of a transmission, which is probably somewhere around, on typical broadband connections, somewhere between 20 and 40 milliseconds. If you add a half a second to that, that's 500 milliseconds. And so now we're talking a significant amount of latency. And that severely affects the types of services that you can reliably run across those traditional satellite connections. Low Earth orbit satellites operate somewhere between 500 and 1,500 kilometers in altitude. The ones that we're going to talk about today operate at about 1,100 kilometers. They're up there moving at a very high rate of speed, about 17,000 kilometers per hour to be able to maintain that orbit. And because of that, because they're not geostationary, they're actually moving relative to where we sit right now. There have to be a lot of them to be able to get coverage. And so these satellites communicate back to ground stations to connect to the internet, and to the end user, they connect to satellite dishes that the ISP would provide. Currently, there are 4 operators looking to either currently operating or in development for the low Earth orbit satellite internet, and those are Starlink, which is the only operator actually allowing public access or that has public access at this time. Project Kuiper, which is a product being developed by Amazon. OneWeb, which is a partnership between a company in India and the UK government, and a Canadian company called Telesat. Now, OneWeb and Telesat are different from SpaceX and Kuiper, and the reason being is that OneWeb and Telesat are targeting commercial high-speed broadband connections. And so they're more focused on providing high-speed data services to enterprises, government, maritime and aviation, commercial operations, where Starlink and Project Kuiper are focused on broadband internet access to the home. So we're going to talk about Starlink for just half a second here, briefly. So that picture of the dish, that's actually my roof. The dish that's on the roof, it's about 18 inches, so it's about that big around. It's not terribly huge. It came in a box, all hooked up, and so when you look at the instructions for putting this thing together, it reminds me of the instructions that come from IKEA furniture, right? A lot of stick drawings, basically. It was very simple, very easy to hook up. It actually took me only about 10 minutes to set it out on the back deck and get it running. So this service is in beta, and what that means is that it's still under development. They don't have as many satellites in orbit as they would need to be able to fully service the globe, is what their target is. It's to service all areas. And so that's an important thing to mention. Starlink's target market is not to compete with existing urban internet service providers. So the Comcasts and the AT&Ts and TDS Broadband really don't have a lot to worry about in terms of competition from Starlink. They are targeting the untapped market of 50% of the world not being connected with broadband. The service is not cheap. It costs $500 for the kit, $99 per month for the service, and so it's by no means inexpensive. However, it works. I've been running on it for probably better part of 2 months now, and I can honestly say it does what it's meant to do, and it provides our home with broadband services quite well. It's interesting, when we talk about funding from the federal government to address this, the politics that goes on behind the scenes, not necessarily behind the scenes because you can read about it, is very interesting when we talk about people or companies wanting to access that funding to be able to build out these networks. Back in November, the FCC had a $10 billion reverse auction for companies to apply for getting funding for their projects to address the rural broadband issue. So there were 180 winners in this auctions back in November for the $10 billion. It's roughly $10 billion. Starlink got almost $1 billion of that, or 10% out of the 180 winners of that reverse auction. And that's a signal from the FCC that the FCC trusts Starlink to meet their goals in terms of addressing rural broadband in their target market of the underserved. And you should have seen just the immense amount of negative press that followed on Starlink after they were awarded this, and they're still getting fought about this. And you're going to see still a lot of negative press about, there's going to be satellites falling from the sky, and none of us are going to be safe anymore, and radiation, and all these other silly things that aren't true. There are some legitimate concerns, and that is, basically sky pollution in space with, the number of satellites that's out there. Although, Starlink has a goal this year of putting up about 12,000 satellites into orbit. These satellites are about the size of a bicycle, if you were to look at them. They're flat, and when the solar array on them is compressed, they look about the size of a bicycle-sized pizza box. And if you think about it, there's a lot of space up there, a lot of space. When we're talking 1,000 kilometers out, there's a lot more space than there is on the surface of the Earth. And I could pretty much say that within a radius of 3 miles of here, there are probably 12,000 bicycles, right? And so spread out all over the Earth, right? That's not a huge density, right? But still, there is the risk of those satellites running into each other. And at 17,000 kilometers an hour, these things are going every which way. You could possibly have a catastrophic chain of events where you have literally satellites exploding above us and scattering debris all over. And so that's a legitimate concern. It's very remote, right? But it is one of the concerns.
So this also brought Elon Musk up to number 2 richest man in the world, I think?
Yes.
Yeah, he's number 2 now.
Starlink is a subsidiary of SpaceX.
Yes.
And so when I get my bill, it actually says SpaceX on it, which is kind of cool.
Yeah, and they only, according to my research, they only have like 9,500 employees. So isn't it amazing what they can do?
It is truly amazing, and you have basically Starlink here is a small outfit headquartered in Redmond, Washington. They have a very good relationship with Washington, it's truly, when you read about the technology that they're using, it's very, very interesting if you're interested in that kind of stuff. And so some of the things that have demonstrated the capability of Starlink is in September of 2020, the town of Malden, Washington was devastated by wildfires. Starlink, this was well before the product was publicly available. Starlink sent several dishes to the town and emergency responders, who turned around and did things like this. They set up a Wi-Fi hotspot for people to access with the phone and power. And so you can see the dish there that gives them internet access there. And they also were able to provide internet access to some of the displaced citizens there. And I do want to acknowledge here at this point, since we're talking, since I mentioned the wildfires, TDS Broadband did a wonderful job at supporting the displaced communities in East Lane County and West Deschutes County due to the wildfires. They provided service up in those areas, and volunteers created internet access for those areas. So I just wanted to mention that publicly. Another thing is that in October, the Hoh tribe in Washington, they're out on the coast of Washington, were outfit. 18 of the 23 homes on the tribal lands out there were outfitted with user terminals. That's what they call the dishes. The community member stated that it was out of the box. This was about 5 minutes, and internet connectivity went from dial-up speeds to 180 megabits. Now, this is a very remote community on the coast of Washington that has really hardly any access to the internet whatsoever. And so, you know, I think from a technologist standpoint, you know, low Earth orbiting satellites is a very interesting, very applicable to addressing the rural broadband problem. It will not solve it. It will put a dent in it for sure. When we talk about providing broadband to rural communities, companies like Telesat and OneWeb will be able to provide backhaul to the internet, so they can actually establish an internet service provider without having to hardline the backhaul into that community, which can be very, very expensive, so that you can bring that whole community online with an internet service provider that can offer services from that backhaul. So there's a lot to look forward with this technology, and you know, if I were a member of a public body such as yourselves, I would be in support of it.
Well, these are really exciting times. That is the big discussion. You know, the rural broadband, it's been discussed, their support. Everybody's like, yeah, let's go do that. And this is interesting, seeing the opportunity is really here for, you know, the brand name of Starlink. You know, you mentioned there's 4 different opportunities out there. But this does change the whole, you know, capacity and capability for rural people to be able to have access. So this is a pretty exciting time. Yeah, we'll see where the dollars flow. You know, the $1 billion choice at the FCC empowered this. I know the SpaceX launches make, you know, kind of national news or international news probably when successfully landing the rockets for reuse, which is cost effective also.
So Joe, are you recommending then, like on Little Butter Creek in Monroe County, that my sister should buy one of these kits, and that would be far superior to what she's doing now?
Well, for citizens, you know, their target. So let me be very clear, and SpaceX is very clear about this also. If you live within the city of Bend and you have good service from Bend Broadband or some other ISP, the Starlink product is not for you, right? You're not going to get as good a performance, and it's probably going to cost you more, right? They are specifically, looking for people who are underserved, right, in areas that are just hard to reach. And the future is looking very bright. We have options now for rural communities to bring themselves online, right? Where before it was just not cost effective to hook into one of the. So let's take for example La Pine, right? It wasn't maybe 5 years ago that Ben Broadband established a point of connection in La Pine. Now, La Pine has had fiber running through it for a couple of decades, right? A lot of fiber. It just didn't stop, right? And so that community couldn't get hooked up to broadband, and so they were stuck to getting standard telecommunication services to bring the signal to Bend to be able to get on to the internet. And we know this because we have the county has linked the South Station. They're using those telecommunication services for years. Today we use the Bend broadband connection and get a much better service to South Station. And it's basically cost. It was just too expensive to establish broadband in that particular area, until Ben Broadband saw that they could probably get enough accounts to service that area and hook them up. And so they expended the money to be able to do that, and we're probably, the county and the city of La Pine probably had a lot to do with that also, the community of La Pine at that time. And so, but now they have options, right? And so, once the broadband connections can be had from overhead, from a satellite, we don't have to wait for that physical connection to come into town. We can just plop a satellite receiver down there, and boy, you got a new ISP in town all of a sudden. And people can get there, whether it's from cable to the home, or maybe 5G at that point, right? You can put 5G antennas and get broadband to the home that way. So it gives us options, and it gives the rural communities an options now that they haven't had before, and that's coming.
Great.
Joe, is there, this low Earth satellite, orbit satellite technology is possibly a game changer, but I mean, we had a whole range of tools and options to try to get to people before. Is there some kind of decision tree type tools or analysis being developed so you could say, all right, if our rural community is this big and this much density, and this far from a main fiber cable, it still makes sense to put infrastructure on the ground as opposed to trying to use this low Earth orbit satellite technology or other options. I mean, how do communities figure out for them what is the best pathway forward, the most efficient pathway forward to get their people the services they need, understanding that no matter what you're talking about, there might be some subsidy, whether it's from the FCC to SpaceX to to a small city or to a county to build put some stuff in the ground to get out to a community.
Sure. Yeah, I mean it all boils down. It all pretty much boils down to what are your options and how much do they cost, right? Municipalities don't necessarily want to get into the broadband business, right? It's not something that they're experienced at, although there are some municipalities in Oregon, in Ashland, Sandy, somewhat in Clackamas County, that...
And all those counties to the north that I mentioned, the Dalles.
Yeah.
Actually, quite a lot.
That are somewhat not involved, right? They're not necessarily an ISP, right? Depending on what it is, what kind of infrastructure they're managing. But there's no barriers there, right? It would be hard, for example, for the city of Bend to do something like that, given that there's all of these options, right? Sisters, I mean, you think about it. There was some operation out of the school district, I think, that they had down in Sisters for internet services for the city. But it's one of those things where how do you reach the community? How do you get the broadest reach, right? So not only do we want to think of Sisters proper, but we want to think of the rural areas outside, and what's the best technology to serve that broad area, and how much does it cost? Who can we get it from? And that decision tree today is still pretty small, right? There aren't that many options, and what the satellite internet brings is it brings them more options at hopefully a lesser cost than burying cable, right? And digging up the ground and knowing that you have no poles and Sisters to run things on, right? To make hard lines cost effective, right? And so you now have we will be getting more of those options, right? And we could see whole new businesses pop up in rural communities in terms of rural broadband services as a result. Which just again, it just provides that community more options in terms of the service. So that and 5G for the last mile, getting to the residents. The combination of these two puts together kind of an exciting product, actually, for a rural community. So,
Time of transition.
yes.
Absolutely. Internet for everybody. Thank you very much for the presentation. I can sense the excitement, and as I say, there's technology things happening out there, that's for sure.
Thank you.
Thank you.
Thank you, Joe.
At this time, item number 8, consideration of signature for redesignation of the Bend Enterprise Zone. Tom can kick it off, and we want to thank Don for joining us.
Yeah, Commissioners, just a few introductory comments, and I'll turn it over to Don. The Bend Enterprise Zone, part of which extends into the unincorporated portion of the county, is nearing its 10-year lifespan. We recently did a redesignation, or within the last year or so, for the Redmond Sisters Enterprise Zone. So similar action here for the Bend Enterprise Zone. So it requires formal action by both the City of Bend as well as Deschutes County Commission to authorize the re-up, if you will, or the redesignation of the Bend Enterprise Zone for another 10 years. So the zone was expanded several years back with some new area. There's some additional expansion occurring along with this redesignation that's entirely within the City of Bend. I think Don will speak to that also, but that's the action essentially in front of you today, is to support and authorize through this resolution the redesignation of the Bend Enterprise Zone. So unless there's any questions with that, I'll turn it over to Don.
Good morning, Commissioner DeBone, Mayor and Chang. I'm Don Mill. I'm the Bend Area Director for EDCO. It's a pleasure for me to be here to talk to you about the redesignation that Tom just described. EDCO is asking for the Deschutes County to consent to the redesignation of the Bend Enterprise Zone with the proposed boundary. While the city of Bend is a sponsor of the zone, parts of the existing and the new boundary for the zone lies outside the city limits, so the state requires that the county consent to those, to the zone. I'll go to the next slide, thank you. I'm going to just briefly run through some of the state implications that cause economic development to be more difficult, why the enterprise zone is helpful. I'll briefly review the Bend Enterprise Zone, how it works, some statistics on how the numbers have worked out in the last 10 years, which are wonderful. Some of the zone growth companies, kind of fun to look at, put some names on the companies to see who's actually participated. Some may surprise you, some may not. And then I'll talk to you about the zone boundary, how that worked, in the next steps. Oregon is becoming a more difficult, thank you, more difficult place to grow businesses. Primarily, taxes, the cat taxes example has risen and is causing problems. We're only one of 7 states, as you probably know. We've been thinking about this tax for a while. Only one of 7 states that has a gross receipts tax. The state of Oregon has also lost some of the various tax incentives that we've had in the past. R&D, child care credit are 2 examples. And the statewide strategic incentive programs don't work very well in Central Oregon. The Strategic Investment Program and the Business Expansion Program, which are both marketed by Business Oregon, are really slated for really large projects that don't often, not impossible, but don't often work in Central Oregon. So our competitiveness to attract and grow companies here is getting more difficult. Next slide, please. This slide is I don't expect you to absorb much that's on this slide. This slide used to be titled, we used to use it as a marketing slide, educational slide for companies considering recruitment here. And instead of saying Oregon's changing business climate, it used to say Oregon's attractive business climate, because our tax comparative position here in Oregon has been great, but it's not so much anymore. So the Tax Foundation does an annual study that ranks the business climate driven by taxes throughout the U.S. And the overall business taxes for Oregon have consistently been in the top 10 in terms of most favorable for years and years and years. Well, the 2021 study dropped us from number 8 to number 15. Not very helpful. No longer in the top 10, not sure we'll make it back. For the corporate taxes only, we slid even further from 33rd in the U.S. to 49th. We're sliding, it makes it difficult to attract and retain companies that are growing here. Next slide, please. A little brief history. As I mentioned, the city of Bend is the sponsor. EDCO is the zone manager. I manage the program in terms of recruiting companies, educating, and then all the processing of the applications, the authorizations, and the year annual exemption filings. EDCO doesn't charge for any of the fees for that. It's just part of our normal services for the companies. We just do it as part of our role. Established in 2010, the zone was expanded in 2017, as you may recall, which was attractive and very helpful. I wasn't here at the time, but looking at the comparative map, it grew a lot, quite a bit, and primarily driven by the UGB. A fundamental quality of the enterprise zone is that it satisfies the economic hardship definition as provided by the state. I'll talk about that more in a minute. The only place that really had ramifications for Bend is in that it affected the size of the boundary. Next slide, please. Just a few weeks ago, John Stark was here with a large project he was presenting, and he went through a thorough review of how the enterprise zone works. If there are questions at the end, I'll take them, but I won't talk much about it because you're fully educated and reminded how it works. But I will mention that the enterprise zone is eligible only to traded sector companies. That term is not what's used in the actual language of the law, but it's similar to the language that we use in other economic development aspects. Basically, companies that generate a large majority of the revenue from outside of the area. So it really restricts the utility of the program to about 10% of the companies in the city of Bend. So it's highly selective. The program is a $50,000 minimum. It's a property tax relief, a temporary relief program where companies are not required to pay property taxes for the first 3 years that new investment is placed in service. There's annual reporting requirements, but the employment has to be retained throughout the period. The City of Bend also offers an extension of 2 years to the standard 3-year exemption if the company, in adding those jobs, adds high-paying jobs defined as compensation 50% above the average compensation in Deschutes County. That converts to about almost $72,000 a year to make that. Next slide, please. So why does the enterprise zone matters? It is and has been for a while the largest and most commonly used incentive in the state for economic development. And why is that? Because it encourages investment and job creation. It provides the ability to increase competitiveness for companies who are moving here and how much more attractive that we can be with those incentives. And it helps companies expand. It also offers the ability to, the timing of that benefit, i.e. the first 3 years after the investment or relocation, is a time of high friction for companies, higher costs. So it helps during that specific period. So it's a great program. It enhances employment growth. It creates wealth. It adds property tax revenues once the exemptions. It increases the amount of just community economic turn that occurs. Next slide, please. Been very successful in Bend. We have one of the most active and largest enterprise zones in all of Oregon. It's just been used for a long time and it's been really great. For the since 2010, when it was started through last year, 54 companies participated, adding $256 million in investment to Bend and over 1,400 jobs. This morning, it occurred to me that the 1,400 jobs, kind of in what context does that stand? Well, since the program requires 10% employment growth to qualify, this is way, way above that. This is like 50% of the available jobs, the employment at the time these programs were authorized. So this 10% limit is way exceeded.
John, excuse me, but ours says that there were actually 65 companies, and your presentation says 54.
So in the memo earlier you received?
Yes, in this memo. Is this one wrong?
That, I didn't know that was being distributed, actually. But I refined it, yes. The 65 actually ends up being the number of authorizations that have occurred. So of the 54 companies, about 65, there's about 65 separate authorizations, meaning some companies have multiple authorizations.
Okay, all right. Thank you.
So both numbers are correct.
Yeah.
I know, I was just going like, well, this says more.
Yep.
More is usually better.
More is good. So the point I'm making is that the 10% threshold to qualify and be exempt from taxes is not necessarily a low threshold, but our companies in Bend have way exceeded that. And so the programs I'm currently working with companies today that are considering enterprise zone, or they have projects under consideration that they would like to benefit with enterprise zone, is 6 companies. Some of those already have programs in place. They plan to invest over $90 million in investment and add almost 300 jobs. So the throughput of this program is still quite high. It's been good for 10 years, and it's good today. The projects are both large and small. It's not uncommon for an enterprise zone company to have a handful of employees and end up today with 20 or 30. It happens all the time. Covers all industries, manufacturing, aviation, biotech, specialty foods, technology, et cetera. It's across the board. So with that, on the next slide, kind of fun to put some names to the program. And the next slide, it was titled Some You May Not Know, so we'll get to that in a moment. But these are, companies that are relatively high profile. They have a retail marketplace in some cases, or they're just large. They cover all industries. Some are founded locally. Some are divisions of large multinational companies. So it's very diverse. And on the next slide is a busy one. These are logos of other companies. And I don't mean to offend anybody. I'm sure a lot of these companies you already know anyway, but not everybody would necessarily. And these companies are the same across all industries I mentioned, large and small. Many of them have multiple authorizations. That 54 to 65 delta we covered a minute ago. So it's interesting. There's some tens of multi-million-dollar projects on this list, and there are some $100,000 projects on this list. So I'll move to the last slide. It's another just example. These are some pictures of three large projects. The one on the left is Brian's Cabinets. It's about a 33,000 square foot facility they just built in the Empire industrial area. I think it's Sockeye Place, I think is the, used to be a large mound of volcanic rock. Now it's a facility. It's great. The authorization was for $7.4 million, and I don't know what up to date. They just moved in the fall. I couldn't tell you what the employment is now, but it's significantly higher than the 6 they committed to, 6 new jobs. On the right is BMS Technologies. They also moved into their facility, about a 45,000 square foot facility in Juniper Ridge. The authorization was for $8.6 million, and again, I think they're above their 5 required enterprise jobs. And the one on the bottom is Lonza. Lonza, they have had several authorizations over the years. Right now we have 2. They just started authorized in 2020. They're in process. Those 2 alone were over $14 million and over 23 jobs. So it's just kind of nice to put some faces on it. And finally, I'll talk about on the next slide, the map, which is the proposed enterprise zone. At the outset, I mentioned that the economic hardship is a key fundamental requirement of the program, and it's defined by the state in its measure of income per capita or per household as compared to the state. It's a measure of unemployment in the area as compared to the state, and it's a measure of poverty percentage as compared to the state. Well, Bend has been relatively prosperous relative to the state over the last several years, so that qualification, meeting those criteria, is getting more and more difficult. So I won't bore you with the details. I can if you'd like, but the state has a process for defining what the area is. It's very complicated and in some cases not that sensible, but this is what it ended up with. So we had to shrink the light beige colored and the green combined is what the existing enterprise zone is, and the light green is the part of the existing zone that we get to retain. The dark green is a small area I had to add. All in all, this meets the criteria on a preliminary assessment by Business Oregon. They won't make a final determination until the application with all the required approvals, but I've spent some intimate time with Artfish at the state to make sure that we're going the right way. So it's going to shrink. The good news is that I believe that the enterprise zone will continue to be of similar value that it has been, and of similar utility, because it retains Juniper Ridge, which is at the top of the map, that sort of squarish, triangular shape at the top, which is where we're all familiar with the opportunities of economic development there. And then the Empire industrial area, sort of just south of that, sort of a diagonal shape with some other points on it, a lot more opportunity there. So those 2 high-value industrial job areas will be retained, and there's a smattering of others, but it's smaller. And with that, I'll close with the process. This is the first leg on the last slide of the approval process, starting with hopefully the county's consent. We'll meet with the taxing districts in early May, where they have the opportunity to understand and make comment on the plan. It's important for everybody to know, but particularly sensitive to it would be the taxing districts to know that the redesignation does not impact current tax revenue for any taxing district. So that's the initial concern that taxing district might have, is that their revenues might go down. They don't go down. The increase is deferred for 3 to 5 years. So with that, we'll meet with the City Council for a work session also in the first week of May for a formal presentation to the Council on the 19th, where we hope to have their approval. And then from then on, the application And the zone expires, of course, July 1 if, as currently designated. And the last thing I'll close with is that the statewide program ends, it sunsets on a global basis, if you will, in 2025. Now, unless it's extended legislatively, which I hope for certainly, and I would expect. Thank you for your time, and I'm happy to take whatever questions come up.
I just find it interesting that of the three typical projects you list, Lonza had a volunteer at the vaccination event at the county fairgrounds last Thursday morning that I met. Their company had that idea that, employees should get back. So he was there working.
Great.
It was his first time. So it was, you see them in our community, and that's what's wonderful.
Great. You may wonder why I put Lonza on the you may not know list. It's a big, big company.
Yeah.
And the reason why I just did that is because it used to be called Ben Research, of course, and many people in non-government or economic development may still not know that. So I wondered when I put it there if that would make sense.
Don, could I go back to the map for a minute? So the beige areas are areas that are now coming out of the enterprise zone?
Correct. Only the light green is going forward, and the dark green.
Dark green is the proposed addition.
Correct.
Okay.
So it's interesting. You see everything we gained in the southeast area with the UGB expansion, we then lose. We lose a small amount of area in the Northwest Crossing, because that was added in when the UGB was added in the 2017 expansion, which is an attractive area to lose. I was disappointed to lose that area.
So people had a window where they could have come in with projects and in those specific locations, and now.
As it turns out, yes. And when I'm talking to companies today, the first thing I say about the enterprise zone is, talk to me and file an application before you hire a single person or spend a single dollar, because that's what preserves it. And the next thing the thing I also add to that now is file an application by June 30th, just in case, just to retain that benefit. But those companies because once you're filed, the application is in my hands by June 30th, it's grandfathered into the larger enterprise zone boundary.
Commissioner, I think just part of your question, Commissioner Chang, is that some of those areas in the central area, although they're maybe coming out of the enterprise zone, they're within the new urban renewal district for the city. So there may be some different benefits that are able to be offered to those businesses, at least in that area. Interesting.
Well, I'd say it's really good to be able to optimize, that's the intention. Let's find those places that could use the investment or the economic activity, where could jobs be located too. So moving the map around is, a function of the process, but it's not a bad thing either.
Mm-hmm. Gotcha.
So it looks like a simple thumbs up type, resolution of support, redesignating the Bend Enterprise Zone. That's the action for today.
So we need that motion. I do want to say I saw Sparrow Bakery was listed, and my husband finally told me, you can quit buying Sparrow. We had like a freezer full because they were saying, please support local so they could get through the pandemic. And yes, I think I overdid it because the freezer was full of Sparrow Bakery. Their English muffins are unbelievable that my husband loves. So, yeah.
Thank you for that.
Yeah, there's some great companies listed, and they make a lot of really wonderful products.
Well,
So, Nick,
I'd move that we approve signature on Resolution 2021-020, redesignation of the Bend Enterprise Zone.
and I'll second that.
Okay, any other discussion? Seeing none, Commissioner Chang?
Yes.
Commissioner Dare?
Yes.
And chair votes yes. Thank you for the presentation. A couple more steps in the process, but I think there may be support for this economic activity.
Thank you very much.
Thank you, Don.
So, Don, when you say we're going to 49th in corporate tax, does that mean 49th worst?
Correct.
That's
Delaware is the only state behind us.
Really, Delaware? Oh, my gosh. Okay. Well, now we know.
Okay, at this time, it will be our lunch recess. There is public testimony for Commissioner Chang. We'll also be on the line during testimony at that time. And then we are rescheduled to get back to this meeting at 3 o'clock today.
Yes, I did.
With that, meeting recessed. Okay, welcome back to the Deschutes County Board of Commissioners meeting on Wednesday afternoon. Next item is agenda number 9, consideration of Homeland Security grant application. Nathan Garabee may be out there for us. There we go. Welcome, Nathan. We just introduced your item here. Thanks for joining us.
Yeah, I thought that was happening. I kind of blipped out while I was switching over. Good afternoon, Commissioners.
So we're acknowledging that in our meeting. Sorry about that. So yeah, when you're brought from a attendant to a participant in a Zoom, it takes you away for a split second. So I understand that now. So we'll make sure to say hello and remind you where we're at when you join us. Thank you.
Welcome back from the void.
I appreciate that. Thank you.
Maybe we need to go to space.
Well, good afternoon, Commissioners. Hope you're doing well. I think I have a pretty quick agenda item this afternoon, although it is going to make a slight deviation from what's in the packet based on information I just learned about an hour and a half ago. And I'll kind of go through that when I go through the presentation. So as many times as we have in the past, I'm here before you to request permission to apply for state Homeland Security Program funds. These are federal dollars that are routed through the state and then assigned to jurisdictions to support catastrophic event and or terrorism-related response and preparedness activities. So they did do a change this year to the grant process, and we have very limited time to get our applications turned around and in. But they did change it, so we now have a partial part of the funds are allocated to the county, and part of the funds remain competitive. And so we have, I did initially believe we're going to have 4 projects. We're down to 3 projects, and we have 1 project that is competitive that we're asking to apply for about up to $275,000 for personal protective equipment and rescue task force medical kits for our fire and EMS agencies to support responding to mass casualty events, particularly related to those that might be a threat of violence. This has been an ongoing project with our fire and EMS agencies in Central Oregon. And the next phase is providing them with adequate equipment to safely respond to these kind of events. And this grant will support fire and EMS agencies throughout Central Oregon.
Nathan?
Including, yes.
I just wanted to have you correct the line up above where it says there are 4 identified projects. We got the new handout, but it should be 3 now. And then what is the year? 4-year, is it 2021 or is it 2022? You know, the line right above it, it says 19.
Yeah. It is. It should be for. Well, it is. It's the grant program 2021. I'll send you an updated memo for signature, and I'll have all that corrected.
Okay.
But it is. It'll be for the 21 grant application year for Homeland Security, and I apologize for that. I will make those corrections. Kind of those last minute changes. I missed that in my edits. So that'll be a competitive grant, and then we're proposing just 2 additional allocation-based grants. So Deschutes County was allocated based on a formula about $76,000. Initially, we're going to do a look at a generator upgrade for Sisters Camp Sherman's main fire station, but it sounds like some new information came in, and they're evaluating that and are going to defer on that to assess need and best course of action. So that leaves $15,000 for security upgrades at the Alice Hatch Center, which is an early learning site with High Desert ESD. And then we're going to ask for, initially we're going to ask for about $30,000 for a new communications command trailer to be deployed in Deschutes County to support Central Oregon significant events. Similar to it would have been a great asset to take over with us when we responded to assist Lane County and other counties, just to have that communication capability, not only public safety grade, but amateur radio, satellite, and cellular LTE. And so we're looking at, we have a current 1 trailer that has some of those capabilities, it's in need of replacement, and we'd like to add a second trailer in partnership with Redmond Fire and Rescue. So we're asking now with this new memo of about $61,000 to balance out our allocation to fund both of those trailers. Initially, we're going to try to do one this year and one next year to kind of spread that share around. But at this point, due to the short turnaround, I think that's the easiest way to utilize those funds to the best ability.
So for the communications trailer, have you heard of Starlink? So we had an update earlier, so that a low Earth orbit satellite-based internet is coming. So that's going to be very much a game changer for rural areas in any location, basically, and on Earth, basically, as it builds out. So it's going to be pretty exciting.
Yeah, as technology evolves, we're looking at these trailers as utilizing these trailers. Not, we're not looking at investing in, tens of thousands of dollars in technology. We're trying to build these to be flexible and be able to easily upgrade it based on if we get new radios or new technology such as Starlink. So that's a great point. That is exciting. I think Washington Emergency Management even got to use it in a test phase during disasters this last year.
Yeah, that's what it was pointed out to us. Okay. Well, so the competitive item on this is basically whatever amount you get, amount of dollars allocated would be the purchase for this equipment?
Yeah, that's correct. There's no match required for any of these funds at this point. And so if we get a partial allocation, then we'll work with the partners to disseminate that as fairly and equitably across the Tri-County, actually, and Northern Klamath County region.
Yeah, okay. Great. Any other questions?
No, it seems like it's due, in a couple of days. So this is great.
Yeah.
Yeah.
I mean, we're going to need it as we keep reminding people, Fire Freeze coming up in May, and I believe our community did get a little warning with those two little fires that took off on Sunday, on Palm Sunday. So anyway, yes. Be prepared, right? It's always better to be really prepared.
Scout motto. Thank you. Yeah.
Very good.
Is there a motion?
I move we approve the application to the State Homeland Security Grant Program.
Commissioners, you might say as amended based on the conversation today, since the old memo is in your packet.
Oh, as amended.
I second.
Okay, any other discussion? Hearing none, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And Chair votes yes. Good. Thank you very much, Nathan.
All right. Thank you. I'll send that updated memo to Sharon. Thanks.
Good luck, Nathan.
All right. Thank you. Have a great afternoon.
Thanks.
Item number 10 is consideration of whether to hear appeal of hearings officer decision on privately owned property for a privately operated airstrip. So Nathaniel Miller will be joining us. Thank you very much for joining us, Nathaniel.
Good afternoon, Commissioners. For the record, my name is Nathaniel Miller. I'm an assistant planner with the Deschutes County Planning Division. Joining me today is Anthony Regini, senior planner. The item before you is to consider hearing an appeal of a hearings officer decision for a proposed private airstrip in the exclusive farm use zone. The application file number is 247-20-000-614-CU, and the appeal file numbers are 247-21-000-287-A and 291-A. Commissioners, I'm going to attempt to share screen and present the property. The subject property is located approximately 4 miles northeast of Tumalo and adjacent to the Deschutes River, which borders the property to the east. The property is comprised of 2 tax lots, tax lot 600 to the west and tax lot 301 to the east. The proposed airstrip would be approximately 75 feet wide and 2,000 feet in length. The airstrip would span across both tax lot 301 and 600 and be oriented in a northeast-southwest direction. The property is approximately 123 acres and is developed with a single-family dwelling and accessory structures on the east side near the Deschutes River. Some background on the public hearing and the hearings officer decision. The public hearing for the proposal was held on December 15th, 2020 to hear the merits of the application. The hearing was attended by approximately 20 to 25 members of the public, and testimony was given both in support and in opposition to the proposal. The open record period extended 6 weeks, and the hearings officer issued a decision denying the proposed airstrip on March 9th, 2021. The hearings officer denied the proposal on the grounds that it failed to meet the standards of Deschutes County Code 1816-040, sub A1 and 2, which are derived from statute. These standards are addressed through a farm impacts test. The hearings officer acknowledged that while the applicant outlined potential farm uses in the area, the application materials failed to adequately address how the proposed airstrip would impact specific farm uses. 2 appeals were made in opposition to the hearings officer decision. The first appeal was filed by Ms. Gould, who opposes the application and requests a de novo review from the Board of County Commissioners only if they agree to hear the proposal. In her notice of appeal, Ms. Gould outlines 10 issue areas that she believes need to be addressed in a de novo review. These 10 issue areas are listed in the staff memo. The second appeal was filed by the applicant, who requests a limited de novo review from the Board of County Commissioners. The applicant asks that the review focus on the farm impacts test and Deschutes County Code 1816-040 sub E, which addresses the aircraft operator in connection with the ownership of the subject property. As for staff recommendations, as mentioned earlier, Ms. Gould requests for a de novo review. Alternatively, the applicant requests a limited de novo review focusing on the farm impacts test and the aircraft ownership. Staff reviewed the matters raised in the notice of appeal from both the applicant and the appellant. Staff notes that each issue area raised in Ms. Gould's appeal was sufficiently addressed in the hearings officer decision and staff report. For this reason, staff recommends a limited de novo review focusing on the specific criteria related to the farm impacts test and aircraft ownership. Staff would also note that this application could be appealed to LUBA, and because the basis for this denial involves case law related to Oregon revised statutes, the board may not be given deference with respect to the farm impacts test. Commissioners, in your packets are 3 orders: 1 to hear the proposal and appeals de novo, 1 to hear limited de novo, and 1 to decline to hear. You will notice in all 3 orders there is a statement acknowledging that the electronic record is posted on the project webpage, and this electronic record is the official record. I would like to make you aware of this change as we are moving towards an electronic record system to better serve the public and to improve our record management. Lastly, as I mentioned to you in my email last week about the files, the official record for you to review as you consider to hear includes everything until the last appeal was made by the applicant on March 19th. 2 letters were received after the appeal window closed and cannot be included in the conversation review process. 1 letter was from Kenneth Katzeroff on March 22nd, 2021. The other letter was from Jennifer Braggart, who represents Ms. Gould, on April 7th, 2021. Staff is prepared to answer any questions you may have.
Questions? So a point of clarity, so you mentioned our direct from statute, our items that this was denied on. So you're referring to Oregon State Statute, Deschutes County Code mirrors those words or just references the state statute at that time. So this wasn't a local Deschutes County decision about the words, the terminology, or anything in those specific items. Correct?
That is correct, Commissioner. Yeah, that specific code criteria is linked to ORS 215-296 sub 1.
Yep, just so, yeah, so it's kind of a statewide words for state's land use system.
That's correct.
Any other thoughts or questions?
And I think that that's important because if this conflict is likely to go to LUBA anyway, if the big questions that are being debated are about state statute, not about how do we interpret our county code, then that would make me much less inclined to want to hear this case.
I would agree with that, since it is.
So it gets down to the content of will not force a significant change in accepted farm or forest practices on surrounding lands, devoted to farm or forest use, and significantly increase the cost of accepted farm or forest practices on surrounding lands devoted to farm or forest use. Deschutes County is a high desert region, marginal soils, and a lot of this is in the record. I'm just, the big picture for me, marginal soils, and, if there isn't irrigation water, it's really, not a productive farmland. So I can see the difference of a fertile, moist valley on the other side of the mountains and the high desert. And this one definition statewide is not the same on both sides of the mountain. So
I definitely appreciate that we're the way that state land use law is applied in Deschutes County. That this is a unique place. In some ways, the application of state law is not perfect, but I don't necessarily think that these quasi-judicial reviews are the place to hash that out. For a situation like this, asking these people to do a second local hearing, after having been through the hearings officer process already, it's adding, it takes time and it takes a substantial amount of money from them. It also, has implications for the county in terms of, staff time expenditure and the time that we as the Board of Commissioners have to spend on other items. Again, if this is likely to go to LUBA anyway, and the issue in dispute is an interpretation of state statute, I don't think that what's the right word? I don't think that putting all the parties involved through a second local hearing is beneficial to them or to us.
Well, and I do kind of come to that same conclusion. So it sounds like all three of us are going in the same direction of denying a review of the hearings officer's decision. So I'll acknowledge that. I want to thank the hearings officer and the process. It is a complete story from an application. I think the record is very valuable in this case, and as I say, I was able to utilize the online system for this review also at this time. So there's three versions of an order. I mean, I think they're all the same order number, and it's just which one we choose.
Yes.
And you can mention if somebody wants to make a motion.
Back at page 58, that is the one denying the review.
Thank you, Dave.
Commissioners, if I may, this is Adam Smith, Assistant Legal Counsel.
Please join us.
I just wanted to note one thing. Nate mentioned that there were 2 letters that would be included in the record if you decided to hear the appeal. I committed to clarify with the parties that there's been some back and forth on those letters, and I committed to clarify with the parties that the board only consider the documents as contemplated by code. Of course, if the board did happen to see any of those letters or anything else, then that could be easily addressed through a disclosure of an ex parte communication. But I just wanted to go a step further than my colleague did and just note to the board that if you did happen to see that any of those letters, disclosure would be relevant. And if you didn't, then no harm, no foul. That's all. Just a procedural issue.
Oh, no, understood. So are you asking us to clarify individually on the record at this time?
I'm
Or
just
just
saying,
for a
if
disclosure?
anybody saw the letter, a disclosure would be appropriate. If no commissioner discloses anything, then I think we can all imply that nobody read the letters.
Yeah, so I did not get that far. I can confirm that. I was not at a spot where I was looking through the record in such detail previous to that notification.
Yeah, I wanted to get past the question of whether we wanted to hear this or not before I really delved into it too deeply.
And I would agree that I didn't read.
Okay.
Okay, there you go.
Thank you, Commissioners.
Very clear now, yep.
So I move that we therefore then sign order number 2021-012, which is on page 58 of our packet. I don't, if there's any, an order denying review of the hearings officer's decision in file number 247-20-000614-CU.
I second.
All right, is there any other discussion? Hearing none, calling for the vote, Commissioner Adair,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes. So all three of us are on the same page.
I mean, the one last thing I would say is I think that saying that we don't want to hear this is sort of affirming the value we place in our hearings officer process. You know, the county makes these hearings officers available to, you know, these are incredibly knowledgeable and skilled, you know, expert people in land use issues to sort through and process conflicts like this that come up. And you know, I guess I'd like to, a decision like this, I'd like to be seen as a affirmation and a value, you know, like a respect and valuation of that process.
Absolutely, I agree, and I had mentioned that already. So, I mean, it's a process to get to this point. The package is very mature, and the points have been put in by both sides, you know, both sides in a contested application, and this is a pretty mature work product that we get to review.
Great, thank you.
Okay. Thank you, Commissioners. Have a good afternoon.
Nathan, thank you. So before we go anywhere else, let's acknowledge our testimony to the legislative session today. Good job. I was able to review that.
So the governor didn't pull you away for?
I did talk to the governor for a moment also, but I'll even update you on that. But yeah, just acknowledging, you know, it was really good. Presiding Judge Wells Ashby was there, and some other testimony, and yourself. And it was pointed out a couple of times how we're happy to pay for a courthouse, where it's a shame that we got to get to that point, but it's kind of a selling point at this time also.
I made sure to say if necessary.
Yes, good job.
But yeah, maybe some of the other people who were offering testimony said you know, emphasized how we were willing to do that, and I do think that it really does distinguish us from you know, other counties that are you know, may have just as strong numbers as we do in terms of the need for the judges, but you know, can't say that they are co-investing in the way that we are.
Agreed. Yeah, but it was a real positive testimony. The whole session went real well.
Yeah,
real well.
No,
Let's just hope the end result is as good as it should be.
Yeah,
This has really gone on
Yeah.
way longer than. It's really unfortunate how little Oregon spends on judiciary. So
yeah,
it seems pretty consistent. What are we paying? 96% of the DA's bills, according to what they were saying. AOC was telling us the other day. So we're already picking up a big tab of a lot of things.
So yeah, I did get a call from the governor, and this was efforts of our health department. Our health department is doing such a great job. They went down multiple paths asking for how can we, you know, expand our offerings of vaccinations. This week is the goal, is my understanding. And the governor's message back was to double down your efforts on Latino and BIPOC populations right now. You know, make sure that we're doing that effort. And as I say, we had just had our COVID update, and that wasn't a topic that we had touched specifically. So her and I were a little bit disconnected. You know, she was responding to something from our health that I didn't understand what was coming in. But it is all good. I've made a few phone calls since. I'm working, I called Brad Porterfield Latino Community Association. One of the things I learned very specifically is that there's really a lower age Latino population and elderly, you know, there's been an outreach big time. But he mentioned that, yeah, but basically they're standing by for the age groups to be offered. Right. And that was good information. So if this all didn't happen, I wouldn't have made that call to ask. So he had pointed out that there's people basically standing by, but they're younger. So then I did mention that, this group 7 includes multi-generational households, frontline workers, underlying conditions for all citizens, So, maybe there's a little effort that's going to happen. I contacted Neighbor Impact and mentioned that, maybe there's an email or an outreach effort too in our health department. We're working with Mosaic Medical very specifically on outreach to, any of these populations. So the focus areas are being worked on at this time, but that was a message from the governor's office right now.
Well, also Volunteers in Motion on Medicine is working with Dr. Jeannie Young.
Mm-hmm.
And Dr. Conway did mention today that the Latinx population wasn't in our COVID numbers currently, because in May they had been significantly, they're 8% of the population in Deschutes County, and the numbers at that time, it was 16% of the positive cases. So that's good to know that it's not impacting them, and hopefully they can get their vaccination.
Yeah.
And I also know that Mosaic Medical has, with their supply of vaccinations, have been trying to make vaccination appointments available to, Latinx populations, in advance of kind of their age bracket, and. Well, I'm kind of curious about kind of what the governor was getting at, because there are a number of so Deschutes County is an agricultural area, but there are a lot of agricultural communities in Oregon where the agriculture is much more labor intensive, and you have large populations of Latinx people who are doing agricultural labor and were eligible for vaccination very early as a result of that. So, I mean, if the governor was kind of asking, like, why isn't more of your Latinx population vaccinated by now? The kind of the characteristics of our Latinx population are a little different than some parts of the state. So, was that kind of what was being...
When her and I were on the phone, as I say, she was kind of responding to something that I didn't understand she was responding to, because it was an ask by our health department. Our health department said, can we move on to our next groups before next Monday, basically, right? So this is just the second half of this week was the question.
Group 8.
And somehow it just touched a nerve through OHA, through the governor's office, for a response to say no, and you should be focusing on Latinx and BIPOC, which, as I say, we kind of weren't asking that question. It's just it's something got lost in translation. So, as I say, no harm, no foul. There's vaccines available for the group 7, and next week we're going to open it up. So
yeah,
but yeah, that was the call, because I was surprised but honored to talk to the governor an hour ago.
Well, the actual highest populations are in Umatilla and Morrow County for agricultural workers. They're like 37 and 25% or something in those two counties. So it is, and it is interesting. I do want to point out that someone who just joined our behavioral health committee really did not feel calling, she said it's Latinx. In her humble opinion, Latinx was not really the term that her group wanted to be identified with. So she said it's a very small percentage that wants that term. So, we've been using it. We're trying to incorporate it, but I was told by Kristen that no, that's really not what she feels is how they would like to be identified. So we have a meeting with her on Friday for behavioral health. So I'll see if she has anything different to say.
Well, as I say, there's the vision, the philosophy of we want to help those underserved communities or whatever, by terminology. Or here's the spreadsheet that says we have 50% of these people and 60% of these people. Because I think we have a disconnect of the data. Because I have a hunch that we're very confident. Outreach has happened. Outreach is being offered, and if somebody's ready and willing, we are available for a shot. So I think there's just a disconnect on kind of the vision of what we're trying to offer and what's on the ground here. But we're going to make a little effort. It's just the end of the week. This is just a small period of time.
No, I mean, we did hear from Nahad and Dr. Conway a few weeks ago that there's there's the cases within Deschutes County, there's a disproportionate number in well, what phrase are we going to use?
Well, but
Latino population.
Yeah,
Exactly.
workers or
Yep.
underlying health conditions, they're available now. If we're not
Right.
getting the word out, let's get the word out. So there's no barriers or blocks other than, maybe it is communication. But, as I say, our health department knows that, multilingual opportunities are there. Outreach efforts are happening. Mosaic is focused on this. So, yeah, what else could we do? Let's do it if we know what to do, so. And so there may be a little bit of press activity, down a few channels. As I say, the thing I learned by making a phone call was it's possibly more of a younger generation, and that's why it really hasn't resonated. If it's been 75 and over, 65 and over, and 60 and over, 59, it's been, okay, well, let's stand by, which has been my mindset too. I'm not old enough for a shot yet. So it's maybe just a natural flow of ages. So I'm signed up for Friday now also.
Okay.
So,
I'll see you there.
there, maybe?
Well, definitely something that we can talk about with Nahad and Dr. Conway
Oh, yeah.
next week, and just make
Tomorrow,
sure that
maybe.
just make sure whatever outreach, if additional outreach would be helpful, or if there's we're seeing vaccine hesitancy there's pockets of it around the county, and these different audiences that have vaccine hesitancy have different reasons. So if there's certain information that needs to be provided or assurances that need to be added, and or just having the right messengers to go and talk to people, we can work on those things.
And that's going to be the work to be done in the near future, for sure.
Commissioners, if I could just add, and based on my conversations with health, that it's possible there may be some underreporting of the vaccinations administered to the Latino population, and health is going to try and get at that better. And if there's some data that needs to be cleaned up to be more accurate of actual vaccinations, then they'll supply that to the state.
Yeah, and if there's somebody thinking that somebody's underserved, please call me directly. We're here to respond to it right now. So we'll go from there. So tomorrow we will have a budget meeting for health. So we will see health department staff leadership in this room tomorrow at our budget committee's meeting. So that's not going to be the topic to start with, but I bet we might be able to fit it in a little bit also.
Oh, yes, because they do have an ask for
Oh, yeah, we'll be talking about a lot of
Spanish navigator,
topics.
or not a navigator, but an assistant.
Yeah. And so the governor was really concerned about vaccination, not kind of what else what are you doing overall to help this specific population avoid getting
It's vaccine supply. That's all of this was about. Vaccine availability at the fairgrounds, high throughput with the National Guard, just getting the people there. So keeping that high throughput facility going, which is going to be out to some date. They're talking about when are they going to switch gears. So it's just all about vaccines. Okay, anything else other? We've got a few items to finish the day. So executive session item or two. So this is going to be executive session for ORS 1926622E, real property negotiations. I made 2 calls since you and I spoke, and it looks like it'll be pretty positive. Is there anything else? Seeing nothing for this meeting. Meeting adjourned.